long-standing tradition of tackling important healthcare issues in a bipartisan manner. I personally, like our witness today, have been very, very concerned and in fact sounding the alarm about this novel coronavirus since January. So I ask, why is this the first official hearing that we're having on this topic? To say this is a disappointment would be an understatement. But not only disappointment, but quite frankly, I'm concerned it took 5 months to have a hearing on this novel coronavirus.
This is just an opening statement.
Issues suggested in the letters that
so we haven't heard from the
I've sent to you this
actual
week.
Witness yet.
We are examining a whistleblower complaint that is only 1 week old before a proper investigation. In these letters, I outlined the importance of addressing the strategic national stockpile, COVID-19's impact on mental health, testing. Certainly we should have a hearing on testing, racial disparities, and provider relief. The lack of attention to these details is detrimental to our nation's overall response to this pandemic. And it is the responsibility of this House and the responsibility of this committee. We continue to stand on the sidelines instead of becoming fully engaged. Every whistleblower deserves to be heard. Dr. Bright has raised serious allegations, and they deserve investigation. Whistleblowers must have their rights protected and deserve to have their allegations investigated with policies and procedures that have been long established and upheld as independent and fair. Madam Chair, on April 23rd, CNN reported that you plan to call Dr. Bright to testify. Dr. Bright did not actually file his whistleblower complaint with the Office of Special Counsel until Tuesday, May 5th. That same day, it was announced on social media that you planned to hold a hearing, but it was not officially noticed until 2 days later. By Friday, May 8th, the Office of Special Counsel recommended that Dr. Bright be temporarily reinstated as director of BARDA so that it could thoroughly conduct its investigation and move forward with its usual processes of reviewing a whistleblower complaint. Despite the hearing memo, no final determination of a violation of a whistleblower statute actually has been made. Following a robust investigation process, the customary setting for a whistleblower hearing would be in our Energy and Commerce Committee under oath in the Office Oversight and Investigation Subcommittee.
Morning, Robin.
To say this hearing is premature and it is a disservice to the investigations of Dr. Bright's complaint, I think goes without saying. You trampled on minority rights. You would have never tolerated that when you were in the minority. You neglected the tradition of this committee, and in the manner this hearing was called. The number of procedural fouls committed in advance of this hearing would certainly have led the chair to foul out of multiple basketball games. Apparently, in a world without sports, this subcommittee has become political sport. More than 80,000 American lives have been lost to this pandemic. It continues to wreak havoc on our communities, not only in terms of physical health, but mental health and certainly financial health.
Let's not have hearings.
We should be conducting a hearing on the real-time implementation of the Pandemic All-Hazard Preparedness and Advancing Innovation Act. And we should have done it in February. As a Democratic counterpart to the primary author, Dr. Susan Brooks, on this legislation, you, Madam Chair, should have a great interest in holding such a hearing.
Trump shut down the airline.
In my district, we've seen deaths amongst young African Americans from COVID-19. We're hearing about a new phenomenon of very young individuals who are dying from an intense inflammatory response apparently sparked
kids are going to be fine.
Infection
we
with
need
this
to get
virus.
them back to school.
Well, we should hear from some of these families and medical professionals to analyze why this virus has disproportionately affected some communities, particularly minority communities. So I've said it before, not all heroes wear capes. Hospitals, doctors, and other healthcare providers are on the front lines every single day battling this virus.
Morning, Betty.
They go to work so we can stay home, which we've done very successfully. The inability to conduct non-essential procedures and visits has led to financial harm to our hospitals and doctors. How are states and the country preparing to ease back into providing medical care? Is the distribution of the Provider Relief Fund in the CARES Act working? These are the questions we should be asking the experts today. I appreciate Chairman Pallone's willingness to hold telephone briefings since we all have our own questions. But let me just say, this pandemic is about the public health of our nation, Thank you for your commitment to hold future hearings on the Strategic National Stockpile, mental health, and racial disparities. I'm happy to help you set the agenda for the rest of the year. I hope you will commit to additional hearings on testing and the Provider Relief Fund. And I request that my letters and your responses be part of the record. I yield
Yeah, he
back.
is a doctor. And he's half Canadian.
Gentleman
so
yields back.
I'm with him,
I think the
100%.
gentleman will recall that I called for a hearing on January 30th. And on the
Morning,
heels
Chris.
of that, it was to be with Dr. Kadlik, Dr. Fauci, all the heads of our health agencies, and it was Secretary Azar that said they cannot come. I'm the top person, and when I come, they will come with me. So that was January 30th.
That's what she said.
Madam Chair, if
I
I
want
may,
to-
they
I'm
managed
not
to go to
finished
the
yet.
Oversight
I'm
and
not
Government Reform
finished yet.
Subcommittee for 2
That's what
days.
she said.
I'm not finished yet. I'm not finished yet.
That's what she
Dr.
said.
Burgess, you've written several letters to me in the last week, and I've communicated to you. I'm happy to sit down with you to review and to come up with all the appropriate hearings that this subcommittee should hold. And we will work together on that. We have a lot of work to do. You're absolutely right. The stockpile, testing, the list is as long as Pennsylvania Avenue. So we will work together on that, rest assured.
Is Pennsylvania Avenue
now I'd
very
like
long?
to recognize the chairman of the full committee,
Now,
Mr.
Yonge
Pallone,
Street
for
in
his
Toronto,
5 minutes,
that's a long
for
street.
opening statement.
Thank you, Madam
World's
Chair,
longest.
and thank you, Ms. Eshu, for initiating this hearing and putting all your energy into it so that we're here today with Dr. Bright. We are here as part of the Energy and Commerce Committee's ongoing work to confront the largest public health and economic crisis of our lifetimes. As been mentioned, more than 80,000 Americans have lost their lives, while more than 36 million others have lost their jobs as of today. This is a national emergency that requires every aspect of government to work together to reduce the spread of this terrible virus so we can confidently begin to reopen our economy. And while this Congress and the President have worked together to enact 4 laws to combat the pandemic and provide economic assistance to the American people, new laws are simply not enough. President Trump and his administration have failed to provide the consistent and stable leadership that is necessary to guide our nation through this public health and economic crisis. For months, the president has delivered mixed messages and misinformation to the American people, creating confusion across the nation. Instead of showing leadership, competence, and vision in a time of crisis, the administration has abdicated its responsibility and forced states to fend for themselves and find their own way out of this pandemic. And while states and frontline healthcare workers were pleading for personal protective equipment, testing supplies, and other resources to protect them and their patients, President Trump's response was to let states fight it out on the open market. For months, the president has refused to develop and implement a national testing program. For months, we've been promised millions of tests were right around the corner. The promises have been hollow. Testing is getting better, but nowhere near what it needs to be. It doesn't help that the president proclaimed about testing earlier this week, and I quote, "We have met the moment and we have prevailed." That could not be further from the truth, Mr. President. Dr. Rick Bright, the former director of BARDA, has come forward as a whistleblower and made serious allegations, including a lack of urgency by administration officials to respond to the virus, mismanagement, and failure to procure necessary supplies, and disregard for public health and scientific integrity. His claims lie at the heart of this committee's concerns regarding the administration's response to the COVID-19 pandemic. We're here today to hear the perspective of Dr. Bright, who is positioned to discuss the administration's preparations and response to this pandemic. Now, the failures we've seen simply cannot persist. That's why the Energy and Commerce Committee continues to conduct robust oversight and to propose bold legislative solutions. We've been demanding answers and information from the administration on testing, contact tracing, the supply chain, food safety, and the safety of food production workers, and attempts to undermine science and public health. To date, we have yet to receive any sufficient responses from the Trump administration. And as for legislation, Congress has already passed 4 major coronavirus response packages that were improved by the work of this committee. And now with the sense of urgency this moment requires, earlier this week, we proposed the HEROES Act, which is to be voted on tomorrow by the full House. The HEROES Act continues our ongoing commitment to providing the healthcare resources and support needed to combat the coronavirus crisis. Our legislation will strengthen testing and contact tracing by finally requiring the administration to develop comprehensive plans with clear benchmarks and timelines and public reporting of key metrics. This will allow transparency so we can see if the Trump administration is fulfilling their promises and hold them accountable if they're not. We also provide $75 billion to support robust testing, contact tracing, surveillance, and containment activities. This is beyond the 25 that was in the last bill. And we simply cannot beat this virus without these efforts in place. Our legislation also ensures that all COVID-19 treatments, drug, and vaccines are free of cost for patients. The bill will help us shore up our public health infrastructure for the long road ahead. Our top priority is the health and safety of the American people. The HEROES Act builds on the progress we have made and lays the foundation we will need to ease social distancing and safely reopen the economy. So I just want to thank Dr. Bright for coming forward and for being here today. I want to thank you, Madam Chair, for bringing him here. And I'm hopeful that this hearing will help us better understand the failures of the Trump administration so that collectively we can find solutions that will help us finally get a handle on this virus. It's the only way we'll be able to protect the American people and safely and confidently reopen our communities. And I thank you, Madam Chair, and yield back.
The gentleman yields back. It's a
Madam
pleasure
Chair.
to recognize the gentleman from Oregon, the ranking member of the full committee, Mr. Walden.
Thank you very much, Madam Chair. And before I use my time, I do have just a parliamentary question for you, if you would yield to that. Madam Chair, yeah.
You can state your parliamentary.
So I know we're operating under really unusual conditions. I get
are.
that because of the mess and everything else, which also affects the layout of the room. I know when we do oversight and investigation hearings, I know that's not what we're doing here. There is a script about whether an individual is accompanied by counsel, whether they want that counsel represented. I've got that script. The reason I'm asking is we're not in O&I, but it is extraordinarily unusual to have a government witness as an individual with private counsel at the witness table and with a microphone. And so I'm just trying to get clarification for future precedent setting for the committee.
If I was to
That's
turn
the
my
only
mic on,
reason I'm
yes, you
asking
should be
this,
able to hear me
obviously have
speak.
counsel. If we should follow the protocol that is prescribed.
I figure if I
in
keep the mic off, I'm
investigations
not going to wake up
committee in
Kevin or
similar
daughter. So,
circumstances.
smart.
Well, I think this is the first time that
that's
it is.
There's more than
we have
hair
another
underneath this
first
mask.
Here, when Dr.
I had my
Bright,
best jokes, too, during that
came in
time.
this morning with his attorney.
I said, "That's what she said," about
requested
14 times right in there.
microphone. And so as a courtesy, I extended the microphone to her.
Yeah, sure.
Now, she's not
Now, they're
a
arguing
witness.
about the
She
lawyer for
will
Dr. Bright
not-
having a
we are not
microphone
going to
or
ask
not.
her
She's
questions.
not a witness,
She
but she did
simply
ask, "Can I please have a
accompanied
microphone?"
her
And so they
client.
said,
So,
"Okay, let's give her a microphone."
I don't.
And
Is
And
it
now
a-
the Republicans are
objection to any of
complaining
that.
that a
It's just
microphone
that-
was given to
Did
the
I read
lawyer
you
for the
what
witness.
This text is, and maybe that resolves it.
Well, this isn't O&I. This is, are
Right,
you
but-
suggesting that we need to follow what O&I does?
I'm just saying that it is.
This-
the witness
this is
not
why the
here in
American
his
people hate
whistleblowing
politics.
Capacity is what I'm told. Is what you indicated. But this is his
They
personal
gave
attorney, if I
the lawyer
understand correctly.
a
But we still don't even know
microphone.
for sure.
Oh, also 80,000 Americans
who
are
you
dead,
are,
but
but
they
we haven't
gave
identified that for the record.
Listen to me.
And
They
all we do
gave
in O&I,
someone
as you know,
a
is
microphone.
You ask if the witness wants to be accompanied by counsel. They
If you're not
respond,
outraged,
yes or
you're
no.
not a patriot.
And then counsel is allowed to move forward, sit at the table, and then the question
the
is
Democrats
asked,
are
will you
the
give
same. Everybody
testimony
gets
or not?
petty.
And if so, raise your hand, do all these things. That's all I'm doing here, is just, we don't
Delaying
usually
time.
do this type of activity in the other policy committees. And we're not usually set up this way, but
would
because
you
of the
like to ask
pandemic we
the,
are. I just think we ought to follow that for future precedent issues. Nothing to do with this hearing, but future precedent is what
It's
we're
a-
dealing with.
it's a good suggestion.
We're all learning how to operate in this environment.
Exactly. All right, the gentleman is recognized for his 5 minutes for an opening statement.
Well,
You don't think
Okay,
it's
here we go.
resolved?
well, are we going to ask if he wants to be represented by counsel, and then who the counsel is?
Dr. Bright, do you wish to be represented by counsel?
Yes.
Okay.
Oh,
Then
okay.
she identify herself for the record.
And for the record, would the counsel please state your name?
My name is Deborah Katz. I'm an attorney
Hey, Barbara.
representing Dr. Rick Bright. with the
We're all
law
getting
firm of
outraged
Katz,
by the
Marshall,
fact that
and
he has a lawyer,
Thank
the
you.
witness.
I think that's all we needed to do.
Hey, Patricia.
Can I, Parliament?
All right,
can I
the
ask a
gentleman-
question?
You don't have to watch this,
Well, the
Patricia.
gentleman is recognized for his 5
Well,
minutes.
if you've got a parliamentary.
Parliamentary question.
Oh, good, a parliamentary question.
So,
The gentleman state is parliamentary.
yeah, will the witness be under oath? Because if you have a whistleblower testimony under O&I, a witness would normally be under oath, and if not today, he's under oath, not under oath, then if we get into whistleblower allegations, how can we be assured that the witness is telling the truth under oath if they're not under oath? And if they're not under oath,
Yeah,
how
'cause
can
nobody
you
ever lies under
talk about
oath.
the whistleblower complaints
I thank the
in
gentleman.
a fair and equitable manner?
I thank the gentleman for his inquiry. All witnesses
I always wondered, like, why don't they
know
just,
that it is
in a fair,
illegal,
but not an equitable manner?
to lie
I just
to
want
Congress.
fairness.
And in our subcommittee, unlike O&I, they are the only subcommittee that, I mean, it's a practice.
That's true.
It's a tradition, but we don't swear people in. But witnesses know that it is illegal.
Swearing you in or not,
to
it's
lie
lying to Congress.
USC 1003 or something, I believe. So,
Thank you.
Yeah, so,
I'm ready.
Most
to
welcome.
proceed. Thank you.
Gentleman is
but
recognized
what
for
I
his
really
5
wanted,
minutes.
Well, thank you,
Madam
Madam
Chairwoman,
Chair.
is
And
to
I
waste
know
more
we're
time,
operating under
and
unique
you're
circumstances.
taking that away from me.
The
I
world is
cry
coping with an
foul.
historic, deadly pandemic that we always knew was possible, but we prayed would not happen. In a bipartisan way, we did everything the experts said we needed to do to be prepared should a pandemic or other hazard strike. Madam Chair, the work you, Dr. Burgess, Representative Susan Brooks, and I and others did over 2 Congresses, when each party has controlled the House, resulted in one product, the Pandemic All Hazards Preparedness Act. Dr. Bright, I know you were part of our efforts in writing and reauthorizing that law, and we thank you for your work. In fact, given the role you once played at ASPR before going to BARDA, you had a big responsibility to make sure
Here's the guy who
Congress
wrote the
provided
law,
the strategic
and Trump got
national
rid of him.
stockpile that it
That's
needed,
so out
or
of
to
pattern
inform us
for
if
him.
there were shortcomings, especially as we were modernizing the Pandemic All Hazards.
We're going to hear from the
Preparedness Act.
whistleblower
And went
apparently
back
after we
over
break for
3
lunch,
hearings we
and
held
then
in
dinner.
the Oversight and Investigation
So stick around,
Subcommittee
Chris.
of this committee, where you testified regarding the Zika outbreak in May 23rd of 2017, the seasonal flu on March 8th, 2018, and the hearing on June 15th, 2018, entitled "The State of U.S. Public Health Biopreparedness Responding to Biological Attacks, Pandemics, and Emerging Infectious Disease Outbreaks." You see, I wanted to make sure we hadn't missed anything. Nothing jumped out at me as I reread the records. Congress dramatically increased funding to ASPR and BARDA. We granted new authorities. We followed your recommendations and those of others who played a key role in this combined effort. Unfortunately, some of the systems we put in place to prepare for a pandemic, systems designed without actually living through something like this, have not performed as expected. We've learned we didn't have enough of the basic supplies that we've always taken for granted. And while Chair Eshoo and I have warned about the potential vulnerabilities of our medical supply chains, especially from China, not enough was done to address the problem, and it still hasn't been fully addressed.
Well, we're not a
I'm
supply
thankful
clerk.
that President Trump
so
invoked the Defense Production Act to ramp
as
up
long as we
US
have enough
manufacturing of
PPE for
massive
Jared, I think
ventilators.
we're
The
covered.
President's used the emergency powers and money Congress has provided to launch unprecedented efforts to search the globe for supplies, to rapidly advance development of treatments and vaccines. But we still have much bipartisan work to do to respond and adapt to the challenges presented by COVID-19 and the lessons we're learning. We have asked for, and this committee should hold hearings to find a path forward to reform the Strategic National Stockpile, to increase domestic manufacturing of critical supplies and disentangle our supply chains from China. We should be exploring strategies for increased testing so we can begin to safely reopen our economy. We need to find ways to improve access to mental health and provide relief both for our healthcare providers on the front lines treating COVID-19 cases and our healthcare workers who have been furloughed because their hospitals are closed. We should be conducting rigorous oversight of the trillions of dollars and myriad new policies Congress has appropriated and enacted in the last 3 months, and we should be really investigating allegations like Dr. Bright's that raise concern about our nation's coronavirus response.
Well, that's kind of what we're doing
That does not
here.
appear to be why we're actually here today, and frankly, it's sad.
Okay.
Dr. Bright, your allegations are serious. They deserve a real investigation. I know the Office of Special Counsel, with whom you filed your complaint, will do just that. And I know they take their work seriously and will hear you out. And importantly, will give those named in your complaint an opportunity to have their side heard as well. I must tell you that many of us on our committee were confused when we learned from a tweet this hearing was scheduled in the wake of your complaint. As you know, that's certainly not how we do things at the Energy and Commerce Committee. Not long after the notice of this being a whistleblower hearing, we were advised you were here as a government witness, not a whistleblower, but then we were told you were not representing the government, but yourself. The hearing title suggests the hearing's about protecting scientific integrity, yet the chair invited a witness who will not be speaking to that issue. So it's all pretty confusing and unusual, to say the least. Here we are in the middle of a pandemic, and we aren't given time to secure our witnesses, conduct appropriate research, or require documents that could aid in our understanding of the situation you face and the country face. Our first discussion with the majority, unfortunately, just occurred 3 days ago. Look, this is really serious business, but in my opinion, this is not the way we should run an investigation. We need to get to the heart
You're
of the
right.
matter.
We should
and we
really
need to
do
look
some
forward to
research
see
here and
what
then
haven't we done
come
right
back when
in
Congress
and
readjourns
country.
in
What
September.
can we band together and fix before fall arrives? And so I thank you for being here. I've enjoyed working with you over the years, and continue to look forward to working with you and others to get this right. And Madam Chair, we have a letter for you asking for a Rule 11 hearing that we'll provide to you. And with that, I yield back.
Thank you. The gentleman yields back. The chair would like to remind members that pursuant to committee rules, all members' written opening statements will be made part of the record. I would now like to introduce our witness, the first panel today. Dr. Rick Bright.
And recess for lunch.
A highly regarded scientist with expertise in the fields of immunology, therapeutics, vaccine, and diagnostic development. For the last decade, he's been a career civil servant at the Department of Health and Human Services. In 2016, Dr. Bright was appointed Director of BARDA, the third Director of BARDA, the Biomedical Advanced Research and Development Authority. As Director of BARDA, he has testified before Congress as a government expert numerous times, including before this subcommittee. I share a special pride with Senator Richard Burr because together it was our legislation that created BARDA. So thank you for your willingness to join us today and to offer testimony, Dr. Bright. We look forward to your testimony. You're certainly familiar with the lights. I don't need to explain those to you. You have 5 minutes for your statement. Welcome, and got the microphone on? There we go. Good morning to you.
Good morning, Chairwoman Eshoo and Ranking Member Burgess and distinguished members of the subcommittee. I am Dr. Rick Bright, a career public servant and a scientist who has spent 25 years of my career focused on addressing pandemic outbreaks. I have a bachelor's degree in biology and physical sciences and a PhD in immunology and molecular pathogenesis. I've led teams of scientists developing drugs, vaccines, and diagnostics in government, private industry, and for nonprofit organizations. I'm here today in my private capacity. The views are my own and not those of the Department of Health and Human Services. I joined BARDA in 2010, and for the last 3.5 years, until April 21st of this year, I had the privilege of serving as its director. BARDA partners with private industry and others in governments to address national health security threats. Today, the world is confronting a public health emergency unlike any we've seen in over a century. We are facing a highly transmissible and deadly virus which not only claims lives but also disrupts the very foundations of our society. The American healthcare system is being taxed to the limit. Our economy is spiraling downward, and our population is being paralyzed by fear.
This sounds bad. Why haven't I heard
stemming from
anything
a
about
lack
this?
of a coordinated response and a dearth of accurate, clear communication about the path forward. Americans yearn to get back to work, to open their businesses, and to provide for their families. I get that. However, what we do must be done carefully with guidance from the best scientific minds. Our window of opportunity is closing. If we fail to improve our response now based on science, I fear the pandemic will get worse and be prolonged. There will be likely a resurgence of COVID-19 this fall. It'll be greatly compounded by the challenges of seasonal influenza. Without better planning, 2020 could be the darkest winter in modern history. First and foremost, we need to be truthful with the American people. Americans deserve the truth. The truth must be based on science. We have the world's greatest scientists. Let us lead. Let us speak without fear of retribution. We must listen. Each of us can and must do our part now. On Tuesday, Dr. Fauci delivered a message in a voice that is clear and trustworthy as he encouraged us to act with caution as we return to our daily lives. We should listen to him and other scientists sharing their expertise. While waiting for a cure and a vaccine, which I believe will come, there are things we must do immediately. We must increase the public education about the basics: washing hands, social distancing, appropriate face covering. They're simple but critical steps to buy valuable time until there's vaccine. We need to ramp up production of essential equipment and supplies, including raw materials and critical components. Shortages of these increase the risk of our frontline healthcare workers, and they deserve the best equipment to protect themselves. We need to facilitate equitable distribution of essential equipment and supplies. And finally, we need a national testing strategy. The virus is here. It's everywhere. We need to be able to find it,
God, get out of the
isolate it,
room.
and stop it. We need to have the right testing for everyone who needs it. We need to be able to trace contacts, isolate, quarantine, and appropriately while striving to develop a cure. Initially, our nation was not as prepared as we should have been, as we could have been. Some scientists raised early warning signals that were overlooked, and pages from our pandemic playbook were ignored by some in leadership. There will be plenty of time to look back to assess what has happened so we can improve. But right now, we need to focus on getting things right going forward. We need a comprehensive plan that everyone knows and everyone participates in. Congress has taken important steps to support the response, and there's much more we can do. With your help, we can get through this crisis. Working cooperatively with our global partners, we can and will succeed in finding a cure for COVID-19. But that success depends on what we do today. We will either be remembered for what we did or for what we failed to do to address this crisis. I call on all of us to act, to ensure the health, safety, and prosperity of all Americans. You can count on me to do my part. Thank you.
Thank you, Dr. Bright. We'll now move to member questions, and I recognize myself for 5 minutes for questions. Thank you again, Dr. Bright. You have a distinguished career. You're one of our country's leading public health experts on how to respond to pandemics
Kirsten.
and national
You're not gonna
security
miss
health
anything.
threats. You're the first government official who's been on the inside, seen everything firsthand.
Oh, you're not
come
leaving?
forward and
I don't know.
share unvarnished experiences about what really happened from January to the time you departed BARDA in April this year in dealing with the virus. So I want to make sure I understand what you're telling us. You stated in your written testimony, a window of opportunity is closing, but it is not yet closed. What do we need to do with the time left to get it right? And if we don't,
Testing.
what do you mean when you say 2020 will be
That's my face mask.
the darkest winter in modern history?
Chairwoman Eshoo, thank you for your question. The window is closing to address this pandemic because we still do not have a standard, centralized, coordinated plan to take our nation through this response.
And we
I
won't.
believe with proper leadership and collaboration across government, with the best science,
The reason
leading
that
the
Trump
way,
is letting the governors make
we
all the
can
decisions
devise
is
a
so that he
comprehensive
can't be
strategy.
blamed for it.
We can devise a
it's his
plan
fault already.
that
But
includes all of Americans.
if one of the
and
states
help
goes
them
bad and has a
help
flare up,
us guide
hey,
us through this pandemic.
what are you going to do?
But time is running out because the virus is still spreading everywhere. People are getting restless to leave their homes. We have to make critical decisions on how to balance the economy and science. My concern about this fall is
Chris, stop being
compounded
crazy.
by my knowledge and preparation in response to many years of influenza outbreaks, pandemic influenza outbreaks, and seasonal influenza outbreaks. In our country in 2017, we had nearly 79,000 people die in the U.S. from influenza. That, coupled with a COVID-19 resurgence this fall, could be devastating for our healthcare systems and for Americans. We have a limited window of opportunity to get plans in place to address both of those.
Thank you. When you look at the first 4 months of this year,
Hi,
would you
Debbie.
describe the government's and the administration's response as a success or a failure?
I believe we could have done better. I believe there are critical steps that we did not take in time.
Was there a failure to respond when you correctly pushed to claim early virus samples from, or to obtain early virus samples from China so we could develop critical medical countermeasures?
From my perspective in working with companies to develop drugs and vaccines and diagnostic, viral samples are critical. As soon as we were aware that this virus could pose a significant threat to human lives, I began pushing for those virus samples, and I met frustration and
And
dismissal.
when did you do that?
I did that in the office of the Secretary of Azar in January. The push for the virus samples initially mentioned on January 23rd, and a strong push on January 27th for those virus samples.
When states
And was
blow
there a
up in 2 to
failure
3 weeks, they're just
respond
going
with
to
the
say, well,
needed
yeah, because we're
urgency
testing more.
When you
So,
correctly
of
pushed to
course.
ramp up production of masks, respirators, syringes, swabs?
Congresswoman, we've known for quite some time that our stockpile is insufficient in having those critical personal protective equipment. So once this virus began spreading and became known to be a threat, I did feel quite concerned that we didn't have those supplies. I began pushing urgently in January, along with some industry colleagues as well. And those urges, those alarms were not responded to with action.
Was there a failure to take immediate action when you correctly pushed to acquire additional doses of the drug remdesivir, which is the only drug so far that has, appears to be at least mildly effective, thank God, for treating people with COVID-19?
There was no action taken on the urgency to come up with a plan for acquisition of limited doses of remdesivir, nor to distribute those limited doses of remdesivir once we had the scientific data to support their use for people infected with this virus.
And instead of acting on your recommendations, was the response of others to try and cut you out of key meetings?
Where's here, Kirsten?
Marginalize your participation?
I was told that my urgings were causing a commotion, and I was removed from those meetings.
My time has expired. I now recognize the gentleman, the ranking member of the subcommittee, Dr. Burgess.
I thank the chair. And Dr. Bright, I hope, as it is clear to you, everyone on this dais on both sides appreciates you coming before us today, even if we are frustrated having this hearing without a full understanding of the facts.
That's kind of why you're
Just
here.
to clarify, you're testifying in your personal capacity and not on behalf of the agency or the administration.
That's correct, sir.
Thank you for that. Let me ask you a question about hydrochloroquine, really even maybe a little bit more broadly, the disease-modifying antirheumatic drugs that have been looked at for therapy for this disease. I ask about hydroxychloroquine because it does seem to be central to whatever disagreement you had with Department of HHS and the administration, but hydroxychloroquine was initially identified as a potential therapeutic because, number one, of its anti-inflammatory effects and its ability to calm things in the immune system. And as we know, one of the features of this disease is the overwhelming cytokine response that overwhelms the host. There also may be an effect of blocking the virus at the point of contact with the cell. Certainly something that probably deserves a little investigation. But again, it's not the only one. There were some other drugs, and I think, if I'm correct, BARDA supported with investments. Acterma and Kevzara, which are thought to have similar impacts on the ability to suppress the cytokine response as hydrochloroquine. Am I correct in that?
There are a number of drugs that we were evaluating initially, Congressman, that we were considering to conduct clinical studies to get further information if they really had an impact and if they were safe to use in patients infected with this virus.
Do you have available to you the dollar amounts that BARDA appropriated or authorized for each of those two drugs, Acterma and Kevzara?
I don't have those numbers available with me now.
Would you be able to make them available to the committee?
I believe HHS could make those available. BARDA could probably make those investments available.
Were you concerned with hydroxychloroquine at the time you made those awards for Acterma and Kevzara? Was the concern with hydroxychloroquine, which became then paramount in your disagreement with the administration, was it already established when you made these other investments in similar medications?
My concerns around the safety of hydroxychloroquine in people infected with the COVID-19 virus were reflective of the scientific review that we received from an interagency group of clinicians and regulatory experts and scientists. At the time that we learned about hydroxychloroquine and chloroquine, there was limited data available, and our proposal and actions were to see if we could identify a source of that drug so the NIH could conduct a randomized controlled clinical study. That's a similar action we took with remdesivir. Once we thought remdesivir had promise from data coming from China, NIH quickly established a clinical study, a randomized controlled study to evaluate remdesivir. So with hydroxychloroquine, that was also our preferred plan of action.
And you, of course, authored the letter to the FDA asking for the emergency use authorization for hydroxychloroquine.
I was directed as a BARDA director from the office of the HHS secretary to put in place an expanded access IND program to make the chloroquine donation from Bayer available to Americans through a unique opportunity that would utilize an app and perhaps would make it available to Americans who were not under close supervision of a healthcare provider. During that,
Of course, this hearing, not really a hearing on hydroxychloroquine, I, of course, would welcome a robust hearing on therapeutics and the research that's going on, what we've invested in, what seems to be panning out, what has not. I'll note that both Kevzara and the other medication may not have panned out. And I think the manufacturing company for Kevzara announced that they'll discontinue part of the clinical study because it looked unlikely to help COVID patients. But I will tell you, since starting this, since you identified yourself and this hearing got noticed, I'm hearing from a lot of doctors, my state, around the country, who have experience using hydroxychloroquine and chloroquine coupled with erythromycin and zinc. And they're reporting significant benefit if it is used early enough in the course and may eliminate the need for hospitalization and ventilatory support.
Gentleman's time
I don't
has
know if
expired.
that's right, but I think
gentleman's
it's
time has
important enough
expired.
that we should look into it and would just be interested if you did that as part of your duties at BARDA.
The gentleman's time has expired. The
May the
chair now
gentleman answer the question?
recognizes,
Would the witness be able to answer the question?
you may.
So I believe it's important. I've heard those anecdotal stories as well. and they were not conducted in the context of a randomized controlled clinical study. It's very difficult to understand data from those types of observational studies or anecdotal stories. So the drug might have some benefit in some populations, but we won't know that until we have that information from a truly randomized
Burgess is a
controlled clinical
doctor.
study.
He should know
Many of
that.
those studies are ongoing now. Some of those studies we're starting to see data from, and those studies in those populations tested haven't shown an overwhelming evidence of benefit from the use of hydroxychloroquine in those patients. But the different studies are devised to look at different angles of it, as you described.
And most of those studies are at the end when someone is already
Gentleman's
critically
time
ill.
has expired.
You can't do those
The
studies
chair
without the drug, though, and you
recognizes
did need to
the,
acquire the drug for this,
ranking-
to
the
perform the
gentleman's
studies.
time,
His
please.
time is
Let's-
expired.
we all want to be fair to each other.
He complains
Gentleman's
about
time has
parliamentary
expired. The
procedure
chair
and then
recognizes,
violates it.
The chairman of the full committee, Mr. Pallone, for his 5 minutes of questions.
Thank you, Madam Chair. And let me just say,
There's
Dr.
nothing good
Bright,
about this,
thank you
Kim.
for your courage in being here. When I was younger, we used to read a book by President Kennedy called Profiles
cares.
in Courage. And,
Move on.
you know,
Nobody
your
cares.
courage in being here reminds
Just
me of
ask
some
questions,
of the people
please.
I read about
We have a
in that
witness.
book. I am concerned, Dr. Bright, that the Trump administration does not have plans for a nationwide vaccine program to ensure that once a vaccine is approved, we'll be able to quickly make it available to everyone. In other words, I don't want to see the same mistakes by the Trump administration, the incompetence that they had with the supply chain and the testing, repeated with the vaccine. And you stated at the outset of the pandemic in January, you began urgently pressing HHS officials to provide the necessary resources to begin vaccine development, but that your pleas fell on deaf ears. And as the pandemic progressed, you also stated you were alarmed by the pressures coming from some administration officials for your agency to invest in drugs and vaccines, I quote, without proper scientific vetting or that lacked scientific merit. Can you tell us where we are now in the hunt for a vaccine and where we could have been had the HHS leaders made investment decisions sooner that were based on scientific merit?
Thank you, Congressman. As we all know, vaccines are very difficult to make. It's nothing that you can do quickly, and you need multiple shots on goal to try to make a vaccine. There are many diseases we've attempted to make vaccines for through history, and we still haven't been able to do so. So it takes many opportunities and many different approaches. Right now, there are over 100 different approaches for developing a vaccine for this coronavirus.
That's right.
So we're confident
Kirsten,
that,
you're up in BC,
hopefully,
right?
I should
Whereabouts
say,
in BC?
At least one of those or two of those will work, but you've identified key critical challenges that we need to anticipate and prepare for early. Number one is the supply chain for those vaccines, needed reagents and buffers and salts and various ingredients that go into a vaccine, as well as the glass vials that the vaccines are put into, and needles and syringes, and then a carefully coordinated distribution and administration strategy. We haven't yet gotten to those downstream strategies yet in our government, and I think those are going to become a significant issue down the road if we don't plan for that now. The urgent need for funding at the outset of a pandemic is something we've known about through many years of pandemic exercises. Even in our August 2019 Crimson Contagion exercise, it was highlighted that we would need at least $10 billion from the outset of a pandemic to start the development of drugs and vaccines. Every day we delay delays the output of that vaccine or drug. And so in those early days, my first meeting with Secretary Azar, I asked for funding for people and for those viruses, the three critical things to get the vaccine started. It took some time to get the funding available through various processes. But what BARDA did is we began to look internally at other contracts and other programs we had to redirect some available funding, some minimal funding, to even as early as January, be able to initiate contracts or agreements with some companies to start working on those vaccines as soon as possible. It's because of those actions now that not only have those vaccines started and made some progress, but also the United States has a placeholder with some of those companies to be able to place orders for those vaccines when they are available. And we did everything possible to ensure that those investments were in companies that would build capacity in the United States to manufacture those vaccines. We had to get in line first, even when the money wasn't fully there to complete the development program. That's what we did.
And I guess my concern is, I've been very critical of administration in terms of their, I call it incompetence with the supply chain, with lack of testing. I'm afraid the same thing's going to happen with vaccines and the distribution. I mean, should I be concerned based on your experience?
Absolutely, sir. We're already seeing those challenges with limited doses of remdesivir, with data that we're getting that remdesivir has some benefit in people. And we have limited doses, and we haven't scaled up production, and we don't have a plan on how to fairly and equitably distribute that drug. If you can imagine this scenario this fall or winter, or maybe even early next spring when vaccine becomes available, there's no one company that can produce enough for our country or for the world. It's going to be limited supplies. We need to have a strategy and plan in place now to make sure that we can not only fill that vaccine, make it, distribute it, but administer it in a fair and equitable plan.
And that's not the case at this point.
We don't have that yet, and it is a significant concern.
Thank you. Thank you, Madam Chair.
The gentleman yields back. I now have the pleasure of recognizing the ranking member of the full committee, Mr. Walden, for his
Thank you, Madam
5 minutes
Chair.
of question.
Here's the problem with all of this. If Trump says we're going to have a vaccine by the end of the year, then Mexico is going to pay for the great health care.
BARDA's responsibility to direct the personal protective equipment acquisition distribution, the PPE. Is that part of your responsibility at BARDA?
BARDA plays a role in pandemic preparedness for our nation, and we prepare and align and exercise with our other federal agencies. We also are familiar with the critical gaps in the supply chain.
Okay.
So while BARDA isn't responsible for procuring those items for the Strategic National Stockpile, we are aware of those shortages and those needs. What I was doing in my capacity as BARDA director was raising those concerns and needs with the appropriate group within ASPR, the Strategic National
But
Stockpile.
ASPR basically has the responsibility to go do that, right? That's not your direct responsibility. You're obviously in this discussion, but that's not housed right in BARDA, correct?
It's my responsibility to raise a significant concern about a limited supply or a shortage that I think will affect the lives of Americans.
Did you raise that concern with people up here on Capitol Hill? And if so, who and when?
I raised that concern with my leadership, sir. I raised it with the appropriate folks in the Strategic National Stockpile and our Critical Infrastructure Protection Program.
Not up here?
My role was to raise it to my supervisor, Dr. Cadlick. I also did raise that concern, though, in the White House with Mr. Navarro.
Yeah, I'm interested because we're passing these bills. In the future, I hope you would, or anybody out there listening in these agencies, if you're spotting something that's not working right, we need to know.
Yes,
On the first case of SARS-CoV-2 in the U.S., it was identified, I believe, in January 22nd in Washington State. CDC put the positive specimen in culture that day, correct?
I believe so. I think it's January 20th.
Okay. It's my understanding the samples from the virus were made available to the U.S. government and that the CDC expanded the virus stocks between January 29th and February 3rd and shared the BEI on February 4th to enable broad sharing. Now, according to your complaint, after virus samples were available to the U.S. government from the Washington State case, and potentially even after the CDC's effort to grow the virus and then share with the BEI biorepository, you were still seeking to obtain a sample of the virus, correct?
That's true, sir, but we need more than one virus.
Right, I'm going to get to that. Why were the strains not available within the U.S. government, not available to you? Were they available to you?
Sir, I was asking for viruses in January because we wanted to make sure that we had a head start on developing the vaccine.
Yeah, no, I get that.
When they became available in February, I believe it was February 6th, through the BEI resources, then those were distributed to laboratories.
Did you ask for the virus sample from Washington State, though, as part of that? You did?
BARDA did. We asked to make sure we had access to those viruses, and they were distributed to the right laboratories and the right companies.
And where did you ultimately get the virus that you distributed sample?
Some of those viruses came from the BEI resources at NIH, and some of those viruses came from laboratories that received the initial seed from CDC.
Okay, that's helpful to know. In some conversations I've been a part of with some at NIH, they indicated that the real key here was to get the DNA sequence, which China did eventually put up, I believe, at the end of December, early January. And that in terms of going after the vaccine, it was that sequencing that really mattered most to get started on vaccine development. And there are other scientists who are very distinguished who believe that the delay in getting the virus sample actually didn't set them back. Is that an accurate assessment, or do you just have a disagreement in that view? And I know scientists disagree, so do we up here. But I'm kind of hearing that having the sequencing really mattered most, and getting the virus important, but did not set them back in proceeding to get the vaccine development underway.
So China posted the first sequence on January 11th, I believe, or made it available January 10th or January 11th. It's important to understand that the sequence is available. When a sequence is available, some companies with some technologies can get started with that sequence information.
And
you
did
still are
they?
vulnerable because you have another country in their laboratories that posts it on the internet or a database of their sequence. So there could still be challenges, especially for national security, about the integrity of that sequence.
Yeah, before my time runs out, it's run out. I was just going to ask, did they begin efforts at that time once they got the sequence?
The NIH began efforts on a synthetic messenger RNA vaccine candidate. However, without the viruses, you really cannot tell if the neutralizing antibodies listed by that, or your diagnostics, or your therapeutics can actually work. You can try to synthesize a virus with a sequence, but it's never going to be representative of the actual virus. And when we're spending billions of dollars on drugs, vaccines, and diagnostics, we want to have the most credible information possible.
Right. Thank you, Madam Chair.
The gentleman yields back. Pleasure to recognize the gentleman from New York, Mr. Engel, for his 5 minutes of questions.
So we can't trust China, but we should have trusted China.
Thank you, Madam Chair, for holding today's hearing. Doctor, if you were a betting man, oh, sorry. Thank you. Doctor, if you
Wasn't
were a
his
betting
mic on?
man,
We could hear him fine.
When would you bet that we would that we would have a vaccine?
That's really not how science
That's
works.
a very difficult question to answer. I know that there are companies and academic labs working very hard. Normally it takes up to 10 years to make a vaccine. We've done it faster in emergency situations, but from when we had starting material in the freezer for Ebola, but for a novel virus, it's actually haven't been done yet that quickly. So a lot of optimism is swirling around a 12 to 18 month time frame. If everything goes perfectly, we've never seen everything go perfectly. My concern is if we rush too quickly and consider cutting out critical steps, we may not have a full assessment of the safety of that vaccine. So it's still going to take some time. I still think 12 to 18 months is an aggressive schedule, and I think it's going to take longer than that to do so.
Well, we've got a whole bunch of volunteers out there protesting.
12 to 18 months from
I mean,
when this all
because, you know,
started at the beginning of the
economy.
year.
It would be 12 to 18 months from when the particular manufacturers first received the material or information that they needed to start developing that vaccine. It's critical to note when we say 12 to 18 months, that doesn't mean for an FDA-approved vaccine. That means to have sufficient data and information on the safety and immunogenicity, if not efficacy, to be able to use on an emergency basis. And that is the consideration that we have in mind when we talk about an accelerated timeline.
Thank you. I represent in New York, Bronx County and Westchester County, which are at the epicenter of the U.S. Coronavirus outbreak, New Rochelle, New York. While New Yorkers have really rallied together in support of their neighbors, the administration has
Is this a question?
failed at every turn. President has sidelined our best scientists, pushed baseless conspiracy theories, and more recently prescribed unproven remedies like Lysol to suffering Americans. Since the early days of the outbreak, the President encouraged doctors to prescribe chloroquine to suffering Americans despite a lack of evidence supporting its use. On April 24th, the President's hand-picked FDA commissioner even came out against the use of chloroquine for COVID-19 cases. Doctor, what are the dangers of chloroquine if prescribed incorrectly, and what happened when you raised the issue of chloroquine use in coronavirus patients with HHS leadership?
Congressman, our concerns centered around the potential use of chloroquine in people who were infected with this coronavirus. There are data of the effective use and safe use of chloroquine in malaria patients and other indications. We also knew that there were potential safety risks with chloroquine to cause irregular heart rhythms and even in some cases death. So our concern was with limited information and knowledge, especially of its use in COVID-19 infected patients and the potential for those risks, then we should make sure that any studies with that drug were done in a carefully controlled clinical study under close watchful eye of a physician so they could respond to a patient if they did experience one of those adverse events. There wasn't sufficient data at that time to support use of this drug in patients with COVID-19 without close physician supervision.
And when you raised that issue of chloroquine use in coronavirus patients with HHS leadership, what happened to you? You were removed as a director of BARDA. Is that not true?
I believe part of the removal process for me was initiated because of a push back that I gave when they asked me to put in place an expanded access protocol that would make chloroquine more freely available to Americans that were not under the close supervision of a physician and may not even be confirmed to be infected with the coronavirus. The scientists at FDA, BARDA, and NIH and CDC worked hard to switch that to an emergency use authorization with strict guardrails that the patients would be in a hospital confirmed to be infected with this virus under close supervision of a doctor and who could not otherwise participate in a randomized controlled study. My concerns were alleviated somewhat by being able to lock that in the stockpile with those conditions. However, my concerns were escalated when I learned that leadership in the Department of Health and Human Services were pushing to make that drug available outside of this emergency use authorization to flood New York and New Jersey with this drug, regardless of the EUA. And when I spoke outside of our government and shared my concerns for the American public, that I believe was a straw that broke the camel's back and escalated my removal.
Thank you, Madam Chair.
Gentleman's time has expired. Pleasure to recognize the gentleman from Kentucky, Mr. Guthrie, for his 5 minutes of questions.
Thank you very much. Thank you, Dr. Bright, for being here. We appreciate it very much. Reading through your complaint, I just kind of want to point out, I think the chairman said earlier, talked about the lack of urgency and implies the president's lack of urgency. I think most of my constituents want to know that things are getting done and where is the president on this. And you're having issues with the leadership at Health and Human Services, and you're giving them recommendations. So if they're not accepting your recommendation to them, I think fairly surmise they're not passing that on to the White House. So the president's probably unaware of what you're putting forth, because it says, and reading from your complaint on page 23, fortunately, White House Trade Advisor Peter Navarro shared Dr. Bright's sense of urgency. So that's in your sense of urgency. So talking about the urgency in the White House, so you have a meeting with him on Saturday. He calls you back in on Sunday. You prepare your recommendations in a memo for Mick Mulvaney, Chief of Staff, so essentially the president. And then, so you get around the leadership of HHS, meet essentially with the president, since with Mick Mulvaney, and it says, you have the meeting with Navarro on Saturday, the memorandum of Mick Mulvaney on Sunday, and on Monday, it says the National Security Council Policy Coordinating Committee met and directed Dr. Kalik and HHS to implement Navarro's recommendations. The push by the White House for HHS to act more swiftly created tension between Dr. Bright and HHS political leadership. So it seems, I don't know how you could be more urgent in government than having a meeting on Saturday, a memorandum on Sunday, and actions on Monday, once it got to the president's attention, the president's level. So we appreciate the president moving forward on that. I'm on the ranking member of O&I, which the investigations, which you've testified in front of us before, and we appreciate that very much. So I'm kind of looking more at the process of putting this hearing together and some things. As we read through your complaint, the only way we have is because you made it public. And in your complaint, there are different exhibits that you talk about, and we're having a hearing today, and there are actually 33 exhibits referenced in your complaint that's not public. I think we got them from the majority through the Washington Post or something like that. That's how we were made documents available for this hearing, in my understanding. So the 33 exhibits that are not made public, that are referenced in your complaint, would you make those available to the committee? Do you have those and make them available to the committee? I mean, if we're using your complaint for this hearing, we need to have the documentation.
May I address that?
The chair, I don't have a problem with you addressing.
Yes, we will take that under advisement and get back to you.
Okay. Also, when we read through
There may be privacy considerations in some of the documents, so we do need to look at these documents carefully.
So also, if you read through the email chains that are made available, some appear complete, but some truly aren't. They're apparently not full email chains. And so you will wonder if the context of the email would relate to the inferences taken from the emails. Would you make all the complete email chains available to us?
I'd like to address that as well, which is a problem is when Dr. Bright was removed from his position, he was locked out of his email. He does not have access to his full email.
So the email chain, so the email chains that you have available, we have.
That's correct.
I can
He does
address
not have a
this.
full set of his email.
I can address this too, and that's exactly right. So I was immediately locked out of my email on April 20th of this year. And so I didn't have full records available to me on that. However, I believe I laid a solid foundation in my complaint, as detailed as I could be, for the Office of Special Counsel to be able to conduct an investigation. I believe as part of their investigation, they'll be able to access those emails and individuals to get a full story and get the full information so they can get to the bottom of it.
It would have been helpful for us as well. Have you shared any of these exhibits with the majority that's not been shared with us in the minority side?
Sir, I believe you have probably what's available in the public domain, and I believe the rest has been submitted to the Office of the Special Counsel, and I haven't made it available to anyone directly.
To the gentleman, the minority and majority members all received the same packet of information.
Which is available to the
Emails,
public.
yeah, that was available, that was in the public domain.
Okay. So just one more, are there any other documents in your possession or accessible to you that are not included as exhibits in the complaint, but are nonetheless relevant to your allegations? If so, will you provide those to the committee?
I believe I've provided the information I have available to me at this point. If I had access to my email from HHS, there might be additional supporting information in that email. I do not know the status, if that's been deleted or wiped, or I just haven't had access to it since April 20th.
Okay, what you have access to. I appreciate your answers. Thank you very much. I yield back.
The gentleman yields back. Pleasure to recognize the gentleman from North Carolina, Mr. Butterfield, for his 5 minutes of questions.
Thank you, Chairwoman, and to you, Dr. Bright, thank you, sir, for coming today, and thank you, most importantly, for your 25 years of public service. Dr. Bright, I'd like to ask you about your efforts to address supply shortages for administering COVID-19 tests. According to your account, as COVID-19 testing ramped up, you asked for an inventory of the strategic national supply availability of testing supplies, including swabs, viral transport materials, and extraction buffers. You learned that the national stockpile did not stock these items. After that, you learned that FDA's source of swabs was a manufacturer in the region of Italy, which was the center of the COVID-19 outbreak in Italy. It is my understanding that this information then prompted you to reach out to the DoD agency that had previously assisted your office with international transportation of supplies related to Ebola. My question is, why, sir, did your office contact DOD at this point?
Sir, it was quite a surprise to me that the urgent ramp-up of the testing did not include full consideration of all the critical supplies needed to support that ramp-up of testing, including those materials you mentioned, swabs, viral transport media, buffers, et cetera. And I was quite alarmed to learn from sitting behind CDC Director Redfield that we were going to experience this shortage of swabs. And I was even more surprised that our strategic national stockpile did not plan or have any of those in supply. So my urgency to find a solution to that was supported by the FDA director of the Center for CDRH, who does devices and diagnostics at FDA. And once I confirmed that there was a shortage, it was critical that we find a solution. And that was by partnering with our Department of Defense colleagues who work with us for the Ebola response. We actually work with them to ship doses of Ebola vaccine from Germany to the United States so it can be filled rapidly to respond to the outbreak in Africa. So it was a natural occurrence or response for me and my colleagues in BARDA to come up with a solution to that critical supply chain.
Let me ask you this, were there any restrictions in place in Italy that would require Secretary Azar to move forward with the request to DOD?
What we needed to enact that air bridge with the Department of Defense was we needed our Secretary Azar to make a request of the Secretary of Defense. And I and my colleague, Dr. Gary Disbrow, raised this issue at our senior leadership meeting with Dr. Cadillac, who chairs that meeting, the ASPR. And it clearly was not a topic that he wanted to discuss on that day. And actually, we were rebuffed by him saying that he did not really want to talk about swabs right now. And both Dr. Disbrow and I raised this concern repeatedly in that call. So knowing that it was critical and time sensitive, and we had a critical shortage of these swabs, I placed a call to Mr. Navarro's office once again and asked if Mr. Navarro could offer some assistance in contacting the Secretary of Defense to get clearance for DOD to put those airplanes in place under the contract we have. And that happened in a very quick turnaround, in a matter of minutes. With that permission from the Secretary of Defense, we were able to start those flights within 2 days. We have now transferred back over 25 million swabs.
So you're saying that you alerted White House Advisor Peter Navarro about this issue, is that right?
Yes.
And within hours, literally within hours, he had coordinated with DOD to start these flights to transport the swabs?
Yes, sir.
Correct. This seems like a logical response to the analysis that you provided. What is truly perplexing to me is why anyone would resist such an initiative. That's a rhetorical question. I won't ask you to answer that. Finally, we still don't have enough testing supplies. I don't understand how and why that is possible. I understand that converting an auto plant to build ventilators might take a little time, but how can we be struggling to get adequate supplies of simple supplies like swabs? What does this say about the federal response to the coronavirus outbreak?
It says to me, sir, that there is no master coordinated plan on how to respond to this outbreak. We don't have a strategy or plan in place that identifies each of those critical components, and we don't have a designated agency that is sourcing those critical components and coming up with a strategy to make sure that we have those supplies when we need them. We need this comprehensive national strategy that's end-to-end about what includes every component to make sure we can respond and protect American lives.
Thank you, Dr. Bright. You're a great American. Thank you very much. I yield back.
The gentleman yields back. Pleasure to recognize the gentleman from Virginia, Mr. Griffith, for his 5 minutes questions.
Thank you, Mr. Chairman. Madam Chairman, appreciate it. It seems like Mr. Navarro's done a pretty good job in listening to the questions. I do wish we had more of the information available, and it's one of the reasons why it's not your fault, but why I wish we had done this through the regular channels. But I would ask this on some of the questions that were just asked about supplies being available. I kind of got the impression from prior testimony that Project BioShield, which you urged us to put money into, and we put $700 million in 18 and 735 in 15 and 19, was supposed to take care of some of that. Am I misunderstanding Project BioShield?
Project BioShield is used to invest in late-stage development of drugs and
So it's for the
vaccines
drugs.
primarily, and some diagnostics. And
So that didn't help on this at all?
it didn't help on this at all, sir.
All right. Now, that being said, and I did say, and I would hope that we would have had everything available to us, and I understand that may not be your fault, but it does create issues. But everything's going crazy. The people have all kinds of things going on. And this hydrochloroquine comes up, and there's some email exchanges in Exhibit 54 from your documents indicate that
Hydroxy.
Christopher Houchins writes, and he says, we should probably take a look at this. I'm paraphrasing, but the line I took out of it was, especially when we have few or no options. One of the frustrations I have had for years with our community trying to respond to all kinds of different diseases is we want to have the double-blind studies in place. We want to have all the science there, which makes sense if you have an alternative. But when you have few or no options, it seems to me you would go after those things that are available. And if hydrochloroquine is one at one point, then remdesivir, I'm assuming, have they done the double-blind studies related to COVID on remdesivir? Has that already happened? And then I've got an article from the Richmond Times-Dispatch, April 15th, where a doctor used high doses of vitamin C and a drug called Actemra, also an Actemra. All of these are floating out there. Doctors are using all kinds of things because we don't have other options. And so I'm wondering, what was
I'm
the
actually
great
hoping that
hesitancy
Kevin
to at
Lee's
least
son
let doctors
had
try, and even if
the
anecdotally was having some
coronavirus.
effect,
So, because
wouldn't
he's
you
feeling
have to
better
have that
now, so that
available
would
in
mean
order
that he
to
had it and
be
got
able to
over
do the
it.
tests? And if you've got
Fantastic. We just want to know
few
so,
or no options,
we can interact.
why wouldn't you want to go down that pathway?
We want to make sure that the drugs that we consider are safe and effective. The highest priority is safety. So many of these studies that we had, or anecdotal evidence or reports we had, did not include a thorough safety vetting of those drugs. There are some known side effects with some of the drugs. Many of these drugs were repurposed, so they weren't built de novo. So we knew about some of those potential safety concerns. And we didn't have any evidence of how those safety concerns would appear in people infected with this virus. This virus takes over a lot of your body and actually infects multiple organs in your body and causes significant inflammation and multi-organ shutdown in some cases before death. And acute respiratory distress syndrome, it really turns your lungs into a brick. And
It's scary stuff. And you said, though, on hydrochloroquine that, one of the problems was you might have a irregular heartbeat. If you're worried about not having a heartbeat at all, that's really not, you're not worried about irregular if you don't have one at all. Am I not correct about that? I mean, that's the concern. People were dying out
the
there,
irregular
and here's the
heartbeat could
first one
lead to
that showed
death
some promise.
when you might not
Why
otherwise
wouldn't we want to
die.
accept,
So, yeah, that is kind of a concern.
An offer from a manufacturer
death.
to give us a lot of this and have it out there for widespread use if the doctors chose, just like the doctor in Richmond. That didn't work in that case. They actually used it in that case, and it didn't work. So he tried something else. I mean, I think that's really what we're going to have to do in an emergency situation. Am I not correct?
We need to do it carefully, sir. We have to make sure that when we have that information available, with those potential drugs available, we are thinking outside the box.
Can't we be so careful that we actually accidentally kill people?
We need to move swiftly, sir, and we've actually to show that we could put up a clinical study in the matter of less than a week.
Okay.
It's important to use the available clinical data, and if we know there are potential risks, we need to make sure that we're cognizant
But shouldn't
of
we
those
be
risks,
using drugs
make sure
without
those
tasting
drugs are
them,
used in a very
without
safe and
knowing what
controlled
they
manner.
do, even
And
if
I
they
appreciate
kill
that.
some of the
And let me
patients?
just say
Shouldn't we be
this.
doing that?
It's our job to ask some tough questions sometimes, but just like you found friendly ears at the White House, you might have found some friendly ears on our side of the aisle here as well. And I would note that in 2018, you were talking about vaccines and you were talking about offshore production. And I said, let me know what I can do to help get more production onshore, but I never heard from you. I'm happy to help. I want onshore production. I'm with you on a lot of these issues. I don't know what's going on behind the scenes. We've got to investigate that. Today, unfortunately, was not the day to do that investigation. We don't have enough information. A lot of stuff is not here for us, but don't hesitate in the future. If you see something, let us know on both sides of the aisle what's going on. I appreciate it, and I yield back.
Thank you.
Is he suggesting
Gentleman
that
yields back.
Dr. Bright was keeping it a
Pleasure to
secret from the
recognize
Republicans?
The gentlewoman from California, Ms. Matsui, for her 5 minutes of questions.
Thank you very much, Madam Chair, and thank you, Dr. Bright, for appearing before us today, and thank you for your public service. Dr. Bright, you described a series of missed opportunities that have left our country woefully unprepared for the pandemic's impact. Many Americans are eager to return to normalcy, as we can all understand. But to even begin safely reopening, we need widespread testing capacity, an organized contract tracing workforce, and a healthcare system that can handle further surge. And ultimately, a vaccine or therapeutic cure is required. I'd like to ask you a series of questions about your warnings to the administration while at BARDA. I'm hoping you can succinctly answer whether you believe each scenario will ultimately shorten or lengthen the time it takes for our country to safely reopen and recover from the coronavirus pandemic. On January 10th, you began pushing HHS leadership to obtain sequencing of virus samples. Given the importance of these samples for vaccine and diagnostic development, has the administration's inaction shortened or lengthened our timeline for reopening?
One thing that always amazes me watching these congressional hearings is just how many Congress people there are.
That means there'll be delay in getting those countermeasures.
I've never
Those
noticed
countermeasures
her
are critical
before,
to
and
reopening
yet
our country.
Okay.
there she is.
Throughout the month of January, you made HHS aware of the urgent need to increase funding to combat the virus. HHS leadership believed that BARDA's budget was sufficient. Has the delay of these resources shortened or lengthened our timeline for reopening?
The delay of those resources have extended the timeline to make drugs available and vaccines.
Sure.
Therefore, it's extended our ability to respond to this pandemic.
On January 18th, you pushed Dr. Cadillac to coordinate COVID-19 planning activities across the government.
You're welcome. What is happening
Dr.
here?
Cadillac initially rejected your request, suggesting it was not time sensitive. Did this delay in coordination shorten or lengthen our timeline for reopening?
That lengthened the timeline for our reopening. We needed those early policy discussions to happen as soon as possible.
From January through March, you pushed for HHS to ramp up production of the N95 masks,
I don't know what
swabs,
that
and
was,
syringes.
but
HHS
sorry.
failed to act quickly. Has this inaction shortened or lengthened our timeline to reopening?
That inaction has put a lot of lives at risk, and our frontline healthcare workers, in no time to reopen our country, will bring those people back to us.
Certainly. Thank you, Dr. Bright. Of course, there are many decisions made outside of these scenarios that influence when we can safely reopen. But from what I'm hearing today, HHS, if they heeded your warnings early, we could have proactively limited the toll this pandemic is taking on our country. It appears clear from the whistleblower report that the Trump administration prioritized political calculations above public health with regard to chloroquine and hydrochloroquine. Despite the lack of data supporting the clinical benefits of the treatment and prevention of COVID-19, the Trump administration promoted the drug's use to the American people because it was seen as a big, immediate win. Dr. Bright, do you believe there are other instances where the administration relied on politics rather than science to make coronavirus response decisions? And what consequences might those decisions have had on public health?
We have a very rigorous scientific review process for all of the investments that we make for the drugs, vaccines, and diagnostics through BARDA and through our department, actually. And so there were some attempts to bypass that rigorous vetting process that caused me great concern and actually increased the tension between me and Dr. Cadillac. Without that scientific vetting, that does increase the risk of a drug being evaluated or supported that could have safety concerns. And we really needed to have the best scientists in our country weigh in on whether or not that drug should be evaluated and how it should be evaluated to address those safety concerns.
Certainly. The Trump administration waited until April to invoke the Defense Production Act to increase the production of life-saving medical supplies like masks, months after doctors began experiencing shortages and 3 months after your initial January warnings. Should HHS have invoked the Defense Act earlier to increase the domestic production of critical medical supplies like masks and swabs?
I'm not an expert on the Defense Production Act and how it's used most effectively. I do believe that we should have been doing everything possible, placing orders early, ramping up supply, ramping up production of those critical medical equipment as quickly as possible, whether or not that's through the Defense Production Act or other mechanisms. It should have been a high priority.
Okay, well, thank you very much, Dr. Bright. I run out of time, and thank you very much for appearing before us today.
The gentlewoman yields back. A pleasure to recognize the gentleman
She was actually
from
pretty
Florida,
good. She
Mr.
asked
Bill
questions,
Thank you.
ramifications.
I appreciate it very much, and I want to thank Dr. Bright as well for your service to our country. I have a few questions, and I'm focusing on the hydroxychloroquine. When was the potential use of chloroquine and hydroxychloroquine as treatment for the COVID-19 first brought to your attention, sir?
I believe it's probably mid-March, between March 10th and March 17th, somewhere in that time frame.
And not prior to that?
Not that I recall. The first I heard of the drug itself was a call I received from Dr. Woodcock at the FDA asking if I'd heard of the drug. And I hadn't heard of the drug, and I hadn't heard of its potential use for COVID-19 patients. She said there might be something interesting to look at. And she forwarded a manuscript, a draft manuscript, and that's the first I learned of the drug itself.
So you weren't aware of any news articles and research papers in January discussing the potential benefits of the drug?
I had heard anecdotal stories and reports, sir.
You had?
I had probably, I can't recall if I did specifically for chloroquine, but I tried to track the media and the scientific journal as well. However, I rely on the guidance of the science within HHS, and the first I had heard of that was from my colleague, Dr. Woodcock at the FDA.
You mean you don't
And
set
then
national
a summary
policy by
report
articles in
from
the
our
newspaper with
scientists at
anecdotal
FDA,
evidence?
CDC, NIH, and BARDA that indicated that the evidence for its benefit was weak. And
What
the
are you, some
evidence
kind
for
of
its safety
sciencer?
concerns
You
was
think you're
stronger.
better than us, Dr.
And they
Bright?
did not believe at that point it was something that should be supported.
Okay, now, again, what was your reaction personally? Did you think it was something worth pursuing initially when you heard it from Dr. Woodcock?
Initially, I said I do believe, I trust Dr. Woodcock and her scientific judgment immensely. And if she mentioned that this is something that we should look at, then it's something we should consider testing in a randomized controlled clinical study, I would be supportive of the team reviewing that protocol and that information to see if it should be used.
Sir, I understand, I've heard from experts, and I'm certainly not an expert in this area, that the drug...
He is correct. He
the
is
one that
not an
we're
expert.
talking about, in this case, hydroxychloroquine, if it's used, first of all, timely, because I understand there's a window there as far as the patient, the efficacy of the drug.
Efficacy?
Have you heard this, that if it's administered properly, there's a small window there for the patient as far as risk is concerned? Can you elaborate a little bit on that if you've heard that? And again, this is not from a layperson. This is from an expert.
That's not how studies work.
We have seen heard of anecdotal data from different physicians that they believe they've seen benefit or patient improvement from use of this drug in either combination with antibiotic azithromycin or a combination with zinc or other vitamin C or other things. But there was never sufficient evidence from a randomized controlled study to show its benefit would actually outweigh the potential risk.
This is all pretty much that episode of the Beverly Hillbillies where Granny has a cure for the common cold. You take it, and then 2 to 3 weeks later, you feel fine.
The benefit either in late stage treatment or early stage treatment. Most of the data coming out from those clinical studies to date haven't shown an overwhelming level of evidence that it has benefits in those patients. Doesn't mean that it might still have some benefit in individuals or a case or two in different studies, or that physicians believe they see a benefit in their patients. But in the context of a randomized controlled study, we haven't seen an overwhelming level of benefit.
Have you reviewed the studies in other countries such as France and possibly Japan on these? I mean, are you... I just want to know, because my constituents ask these questions. Do you take those studies into consideration when you make these decisions?
We absolutely do. We look at the quality of those studies. We understand, look to see if they were done with the right controls in place and the right sample size. Was it statistically relevant, or was it just a few people, or was it 20 people, or was it 2,000 people? All of that adds to the power of the data itself. Many of the studies that we saw early only included a few number of patients, and so it was unclear, even from the description of some of those studies that were not in peer-reviewed journals, whether all the patients were treated the same, whether they had full participation throughout the clinical study itself. And looking at the statistical power of many of those studies, they were very small. So it's really difficult to understand the impact, the benefit. We also saw a study that the VA hospital conducted with hydroxychloroquine that showed people who were treated with hydroxychloroquine appeared to have a higher rate of death than people who are not treated with hydroxychloroquine. So that study too has weaknesses. No study is actually perfect. You take all of that evidence into account when you make a decision on how to further study the drug or how to use that drug.
It's my understanding that not my constituent, but a U.S. citizen a veteran, was cured. Again, this is just from what I've heard from the drug. That was a late stage case, but I've also heard of early stage cases as well. So I wanted to get that on record. Thank you, Madam Chair.
I wanted to get it on record that some people do recover from the
Pleasure to
coronavirus.
recognize the gentlewoman from Florida.
You know,
Ms. Castor, for her 5 minutes.
Vast majority.
Thank you, Madam Chair. Dr. Bright, thank you for speaking out to save lives. I read your whistleblower filing, and I want to ask you about the N95 respirators. These respirators are essential personal protective equipment. They're not the cloth mask or surgical mask that everyday Americans are encouraged to wear by the CDC. Dr. Bright, are N95 respirators necessary to protect the lives of nurses, doctors, EMTs, and those on the front lines?
Yes, they're required essential personal protective equipment to protect those frontline healthcare workers from getting infected.
And this is not a hypothetical concern.
If you're just joining us on Twitter,
the LA Times reported a tragic
click the
story
button
about a
to
heroic
open up the
nurse,
chat. You can see the
Celia
chat way over
Marcos,
there.
who appears to have died because she lacked an N95
That chat is
respirator
not something you can
when she
chat in, but if
rushed
you're on
into a
Twitter,
hospital room
you
to
can
try
click a
to
little
save
button
a
that lets you open up
COVID-19
Periscope, and then that
who had stopped
Periscope lets you
breathing.
chat.
And this brave nurse
Twitter owns
is not the only
Periscope.
one.
That's their
According to
video
another
format, and I don't
report,
know why
over
they keep it
700
separate, but there you
staff
go.
at just one Detroit area health system have tested positive for COVID-19, and the CDC reported over a month ago that over 9,000 healthcare workers had already contracted COVID and dozens have died. And I checked with my Tampa Bay area health providers, and one Tampa hospital said N95s are still very difficult to procure. She said there's a dire need for N95s. One of my community health centers says we continue to struggle to get N95s. And there's so many folks trying to sell knockoffs. And then a large Tampa Bay area health system said the supply chain remains inconsistent and irregular, and Baycare remains concerned as we head into the fall for N95 masks. The demand will continue to increase due to the flu season and the continued presence of COVID-19. Dr. Bright, you understood that America would face a shortage of respirators in January. Is that right?
We understood America would face a shortage of N95 respirators for a pandemic response in 2007. And we have exercised and known and evaluated that number almost every year since 2007.
But was it January of
exercised
2007?
Even as late as early as 2019, August, in Crimson Contagion, that we would need 3.5 billion N95 respirators in our stockpile to protect our healthcare workers from a pandemic response.
And you sounded the alarm repeatedly, but were ignored by the senior leadership at the
In
Department
Trump's
of Health
defense,
and
we've
Human
only known
Services.
about this
Please
for 13
explain
years.
what steps that you took and the response you received.
We knew going into this pandemic that critical medical equipment would be in short supply. I began getting alerts from industry colleagues in mid and late January telling me that from an outside view, from the industry view, that the supply chain was diminishing rapidly, telling me that other countries that we relied on to supply many of these masks were blocking export and stopping transfer of those masks to the United States. I learned that China was trying to buy the equipment from the United States producers to have it shipped to China so they could make more. In each of these alerts, and there were dozens of these alerts, I pushed those forward to our leadership in ASPR, to Dr. Cadillac and his senior leadership team. I pushed those warnings to our critical infrastructure protection team. I pushed those warnings to our strategic national stockpile team, who has the responsibility of procuring those medical supplies for our stockpile. In each of those, I was met with indifference, saying they were either too busy, they didn't have a plan, they didn't know who was responsible for procuring those. In some cases, they had a sick child and would get back to it later in the week. A number of excuses, but never any action. It was weeks after my pushing that finally a survey was sent out to manufacturers or producers of those masks, a 5-page survey asking producers or companies if they actually made those masks.
In your whistleblower
There's your
filing,
soundbite.
you discuss a February 7th meeting of the department leadership group at which you urged the department to focus on securing N95 masks. Can you describe what happened at that meeting?
They informed me that they did not believe there was a critical urgency to procure masks. They conducted some surveys, talked to a few hospitals and some companies, and they didn't yet see a critical shortage. And I indicated that we know there will be a critical shortage of these supplies. We need to do something to ramp up production. They indicated if we notice there is a shortage that we will simply change the CDC guidelines to better inform people who should not be wearing those masks, so that would save those masks for our healthcare workers. My response was, I cannot believe you can sit and say that with a straight face. That was absurd.
In fact, it took 3 months from your initial warnings until mid-April for the federal government to invoke its authority under the Defense Production Act to require the production of millions of more N95 masks. And even then, the administration required the production of only 39 million masks, which is far fewer than you and other experts said that we would need. What was the consequence of this 3-month delay and inadequate response? Were lives endangered?
Lives were endangered, and I believe lives were lost. And not only that, we were forced to procure these supplies from other countries without the right quality standards. So even our doctors and nurses in the hospitals today are wearing N95 marked masks from other countries that are not providing the sufficient protection that a U.S. standard N95 mask would provide them. Some of those masks are only 30% effective. Therefore, nurses are rushing in the hospitals thinking they're protected, and they're not.
Thank you for your courageous effort.
Gentlewoman's time has expired.
Jesus
A
fucking
pleasure to
Christ.
recognize our colleague from Indiana, Dr. Bouchon, for his 5 minutes.
Thank you, Madam Chairwoman, and thank you, Dr. Bright, for testifying. I appreciate it. I was a cardiovascular and thoracic surgeon and been in healthcare for over 30-some years, so I
don't know who that is, but he looks Republican.
I'm not going to ask a question about hydroxychloroquine. I just want to comment on how the medical community responds to this type of thing. Doctors across the country will use drugs off-label in a circumstance where they don't have or they don't see a viable alternative to that. And I think this is one of those circumstances. I'm hearing from doctors across the country. And look, I'm with you. You have to have double-blind studies. You have to have proof under normal circumstances. But in this situation, I think a little bit of understanding and leeway from the federal government is in order. We do want to ensure the safety. This is a drug that has been proven safe for many, many years in the appropriate doses. It does prolong the QT interval, as you've outlined, which can lead to cardiac arrhythmias if not used properly. But I mean, tell you, when states tried to
or sometimes when used
doctors
properly
from using this, there was such a backlash they had to back away from it because the physicians in the community wanted to use it. And so doctors like me out in the real world, if things are working, even anecdotally, they're not going to wait for the government bureaucracy to approve it. I just want to get that on the record. I'm just saying this is why doctors are using this drug. Whether it's right or not, data will show. But, if 2 years from now we have the studies and we say, hey, that stuff really would have worked, and the government stopped that from being used, if I was a family of a person that was stopped from getting hydroxychloroquine, I'd be pretty mad. I want to talk about the supply chain issues and as it relates to PPE.
So what if a few people had heart attacks and died because of it?
I think there's enough blame to go around in the federal government about what happened there. For after H1N1, where national stockpiles were depleted, we didn't replenish them. We've had people on both sides of the aisle talking about this, and I think there's some blame to go around. But I don't want to be accusatory, but I do want to go over some of the facts about BARDA's situation as it relates to the masks. Okay?
Trump has been in office for 3 years and yet
2015,
claims that there was nothing in the stockpile.
And a company now known as O&M Halyard, H-A-L-Y-A-R-D, announced a project to develop rapid pandemic mask production line. According to federal contracting records, in 2017, HHS signed off on a $3.3 million, with an M, payment to Halyard to build a machine that could churn out millions of protective respiratory masks at a high rate of speed during a pandemic. However, in September of 2018, CNBC reported that the machine was never built. And despite BARDA's $1.5 billion with a B budget, the Washington Post reported there wasn't money to pay for the project. Why was the project scrapped, and did you sign off on that decision?
So that project with Halyard was to build a novel new machine to make respiratory protection face masks faster, as you described accurately. Right. Actually, the technical team must have reviewed that proposal on the next step or the further investment in that machine. I believe that the investment to date was made to design the machine, build the blueprint of the machine, and I'm not even sure if it was to build an actual
at that time, in September 2018, were you the head of BARDA?
In 2018, I was the director of BARDA.
Right, so did you sign off on the decision? Because I would expect a decision like that, a contract, money was allocated apparently from HHS to BARDA to do this. I wouldn't expect that to be scrapped without the director of BARDA signing off on that, right? So did you sign off on it? It's a yes or no question.
Not necessarily scrap the project, sir. I don't know what the proposal was, that we rely on a very thorough vetting process in our contracting office. So that proposal to further continue that project never made it to me. So if it wasn't approved, it didn't make it through the proper vetting process in BARDA. The decision to end or continue that project was not brought to me.
Okay, I find that surprising, but I'll take your word for it. Nicole Lurie, who hired you, told the Washington Post that the Halyard contract was part of an explicit strategy to ensure we could surge mass production in the next crisis. Well, now we're here and we don't have it. So we're dealing with the consequences of that decision. And in addition, I guess, to the Halyard, I keep saying that wrong. It is my understanding, well, I'm running out of time. So what I'm going to just say is, look, to doctors across America, it's easy for us to sit in Washington, D.C., whether we're members of Congress or whether we're agencies, and talk in the abstract about people dying in our intensive care units. But when you're the physician at the bedside and there is a medication that has promise and that has a safety profile that we understand, doctors will use this medication offline. And that's what's happening. And whether that's right or wrong, we might take us years to prove, but in the meantime, people can die. So I yield back.
Gentleman's time has expired. It's a pleasure to recognize the gentleman from Maryland, Mr. Sarbanes, for his 5 minutes of questions.
Thank you, Madam Chair. Dr. Bright, welcome back to this committee. The United States government deploys millions of dedicated public servants working together to achieve our shared goals as a nation, to promote effective government, and to protect the public interest, in this instance, to protect the public health.
Here's an idea. During these trying times, why not give all the witnesses a cat?
It shows that your superiors at HHS and potentially beyond, instead of valuing your expertise and experience, squandered it in ways that in this moment, in the face of this crisis, amount to gross negligence. They ignored your science-based pleas to pursue critical strategies, for example, your repeated calls to obtain virus samples from China, and to find supplies, masks, respirators, swabs. They dismissed your science-based warnings about pursuing unproven strategies. They dismissed your concern, for example, about the stampeding towards hydroxychloroquine. We've heard about that today. And they sent you on errant missions to find treatments with little therapeutic value, all for the sake of satisfying political cronies. And you've testified about the miracle cure drug that was an example of that. Ignoring, dismissing your input was not harmless malpractice, because there's every reason to believe that if that input had been heeded, particularly your pleas for action in the early days of the pandemic, it might have saved thousands of lives. I want to thank you for coming forward. I want to thank you for blowing the whistle on the misguided and chaotic response to this pandemic. I am sure there are specific conversations, emails, moments in time that you remember like they happened yesterday. The inflection points where, if the response to your warnings had been heeded, things might have been different. And I'm sure they haunt you and keep you up at night. From January of this year, tell me about just one specific moment when you had that sinking feeling in the pit of your stomach because you were not seeing the response that you knew needed to happen.
Congressman, I'll never forget the emails I received from Mike Bowen and indicating that our mask supply, or N95 respirator supply was completely decimated. And he said, we're in deep shit. The world is, and we need to act. And I pushed that forward to the highest levels I could in HHS and got no response. And from that moment, I knew that we were going to have a crisis for our healthcare workers because we were not taking action. We were already behind the ball. That was our last window of opportunity to turn on that production to save the lives of those healthcare workers, and we didn't act.
Listening to your testimony gives me chills because it all adds up to one inescapable conclusion. It didn't have to be this way. There was another path. Things could have gone differently. The federal response to the pandemic could have been much more effective. So here we are, at a moment when our country needs the kind of expertise and science-based guidance that you and others like you can offer us. These voices are too often being sidelined. Things are upside down. In you, we have someone who made the right call in the early days and has been removed from your position, while so many people who made the wrong call still have their jobs. Dr. Bright, when the counsel that you and others offer is cast aside, and I know you know this, it means that science and reason are also being cast aside. That's a dangerous impulse. It's an attitude that deprives our country in this critical moment of any real chance of getting ahead of this pandemic. But hopefully we can learn from this. There's still time to put science and reason back into the national strategy for fighting COVID-19. We need people like you to help lead us through this. The federal response has got to get smarter. It has to put science ahead of politics and cronyism and wishful thinking. Our committee will continue to press for that in the days ahead, and I know that you want to look forward. So tell us, what can we do now to learn from the mistakes of January and February and March and make sure that we navigate and lead our country through this public health crisis?
Congressman, we need to install and empower leadership. And we need to unleash the voices of the scientists in our public health system in the United States so they can be heard, and their guidances need to be listened to, and we need to be able to convey that information to the American public so they have the truth about the real risk and dire consequences of this virus, and they have the truth about the consequences of their actions if they don't follow those guidances. And we don't have a single point of leadership right now for this response, and we don't have a master plan for this response. So those two things are absolutely critical. I would also encourage Congress to ensure there is oversight in this response. Large sums of funding have become available to help us as scientists and others respond to this outbreak. And without proper oversight of those dollars, I'm concerned that they could be misdirected and lost and not put to the right fight. So I would urge Congress to continue and increase their oversight in how those funds are being spent and making sure they're prioritized and used appropriately to end this pandemic.
Thanks for that caution. I yield back.
The gentleman's time has expired, and he yields back. Pleasure to recognize the gentlewoman from Indiana, Ms. Brooks, for 5 minutes for her questions.
Thank you, Madam Chairwoman. Dr. Bright, with all due respect, the Vice President was named the head of the Coronavirus White House Task Force, which was actually a recommendation from a bipartisan blue ribbon study panel that issued recommendations years ago and thought the office of the Vice President ought to be in charge of the response. And so, with all due respect, I believe there is that coordination. And part of what I'm very, very concerned relative to this hearing is that there's the impression being made that there's been no plan. And in fact, that's part of what the reauthorization of PAPA that I worked closely with you, Dr. Kadlec, that Congresswoman Eshoo, Dr.
The White House is literally blocking the CDC plan for reopening America right now. It's been 19 days, and the White House is blocking the plan. Well, they're editing.
Members of Congress and most members of the American public didn't know we had strategic national stockpiles and that we might actually be short some of these things until this all hit.
Or until 2007.
And it was signed into law in June of 19. Do you recall that?
Yes.
And Dr. Bright, you joined BARDA to lead the influenza division in 2010, right after H1N1, because of your expertise. And we rely on your expertise, and you became director in 2016. After, and you mentioned it in 2007, but after the 2009 H1N1 pandemic, the supply of masks in the Strategic National Stockpile was not resupplied. You've mentioned that actually we've had a problem since 2007. So, but I have to share with you, members like Congresswoman Eshoo and I who've had discussions about this, many of us really didn't know that. We, as members of this committee, did not know and were not told of these shortages of masks as we worked through reauthorization of this important law. Were you aware of this issue, and did you push HHS to maintain mass production for purposes of replenishing the Strategic National Stockpile before this happened in January?
Did she just get here?
Before 2017, we actually held an annual review of the Strategic National Stockpile that was chaired by Dr. Laurie at the previous ASPR. Since we removed the Strategic National Stockpile from the CDC management under the ASPR management, we have not yet had an interagency, cross-departmental review of the supplies in that Strategic National Stockpile. We went through an annual prioritization process. There's always been limited funding and never enough to completely top off the stockpile.
Did you know Greg Burrell?
I do.
He retired.
Yes.
Prior to all of this happening. He led the Strategic National Stockpile.
Yes.
Did you have conversations with Greg Burrell from 2009 until 2020 about what was in the Strategic National Stockpile?
Absolutely. The flu risk management meeting met on a monthly basis, and each year they reviewed and prioritized items that should be purchased by the Strategic National Stockpile.
Okay.
That body, which I actually directed for some time, made recommendations and prioritizations to the Strategic National Stockpile. However, it was the Strategic National Stockpile's responsibility to make those purchases.
And how about FEMC? Does BARDA participate in FEMC? And would you please, very, very briefly, because my time is limited, explain what FEMC is? This is a plan that experts like yourselves participate in. So I
After I explain what it is.
There have been plans. there have been plans that FEMC had forth a 2017-18 implementation plan. The White House put forth in September of 2018 a national biodefense plan. Did you participate in that national biodefense plan?
I did, and many of us did.
And it was the first time that our country had actually put forth a national biodefense plan. Many said it was kind of landmark, and same thing with FEMC, putting forth many plans. So I want the American people to know a lot of folks over a long period of time have been focused, but yet we did not still have enough. We didn't have enough swabs, we didn't have enough masks, we don't have enough gowns for all of those incredible healthcare providers. So I don't want everyone to be given the impression that you raised the flag just in January, okay, when you saw it was short, because you hadn't gotten the job done prior to January, and you were at those tables, as were so many others. This happened over a very, very long period of time. And those of us have been very disappointed to learn what was and was not in the Strategic National Stockpile. I thank you for your service. I thank you for your expertise. But across the board, over many administrations, we did not do enough, and I yield back.
Do you want to respond, Doctor?
Well, then, yeah, we should hold the current administration responsible.
They were not pulled out in January of this year and followed. They were not put on the table with a strong leader indicating these are our plans, everyone fall in line and follow through with this plan. I think it's important to emphasize the FEMC is the Public Health Emergency Medical Countermeasure Enterprise, which is comprised of many great scientists from across our government to put these plans in place. But since 2017, we have largely dismantled that FEMC organization. We have not had those interagency discussions for a number of years. The Executive Enterprise Committee and Executive Leadership Committee, we may have had 1 or 2 meetings at most in a new restructured or reorganized FEMC organization. So the partners and colleagues across government haven't had those venues to even talk or coordinate for a number of years to understand what that plan looked like and how they would work together to implement that plan when the day came to need it.
Because of course.
The gentlewoman's time has expired, and she's
No, I'd like to
yielded
hear a
back.
response. Can we give her additional
Pleasure
time?
to recognize,
Can a
the
Democrat
gentleman
please
from New
yield some
Mexico,
time?
Mr. Lujan, for your 5 minutes of
Come on,
questions.
give her time to respond.
Thank you, Madam Chair. Dr. Bright, you've described pressure from senior Trump administration officials to promote the malaria drug chloroquine and hydroxychloroquine to treat COVID-19 despite the lack of scientific support for this treatment. According to your account, when Bayer offered to donate chloroquine pills to the Strategic National Stockpile on March 17, your team of experts at HHS determined that, quote, there are safety liabilities associated with the drug, close quote, and that, quote, accepting the donation could lead to widespread use that is not supported by any clinical data, close quote. Further, one of the public health experts advising you said, quote, no data available to support that chloroquine provides clinical benefit to the treatment or prevention of COVID-19, close quote. Yes or no, Dr. Bright, are there safety liabilities associated with chloroquine?
There are, yes.
According to your whistleblower complaint at the time of the Bayer offer, the consensus from BARDA and FDA scientists was that it was advisable to wait for additional clinical data before making any recommendations on the use of chloroquine to treat COVID-19. Is that correct, yes or no?
That is correct.
Yet on March 19th, the Bayer moved forward and announced the donation of chloroquine, and President Trump told the country at a White House press conference that the drug had, quote, shown very, very encouraging early results, close quote. Yes or no, was the president's statement accurate?
I do not think that was the best informed statement.
In that press conference, the president also said that the drug had, quote, been around for a long time, so we know things don't go as planned. It's not going to kill anybody, close quote. Yes or no, is that statement accurate?
The drug had been around a long time for its use in malaria, but it had not been around for a long time for its use in COVID-19 patients. That's a different indication, different clinical outcome, and the drug can behave differently in those people.
Yes or no, is it true that within days of that press conference, you received urgent instructions from HHS General Counsel passed from the White House directing you to obtain the authorization necessary to make the drugs widely available to the public?
That's true.
Yes or no, did the pressure from the White House and HHS General Counsel put you in a difficult position?
Yes.
And how did you handle this pressure while still trying to protect the American people?
We had to come up with an alternate solution that our administration would accept.
Yes or no, did the administration respect this compromise?
They accepted eventually. The emergency use authorization option was accepted by Dr. Cadillac and the administration, yes.
What I'm aware of, and I would agree with that the HHS Assistant Secretary for Health, Admiral Brett Goyer, on April 4 said this compromise, quote, matters not, close quote, and that the drug needed to go to pharmacies as well as hospitals. Dr. Bright, there are only 24 hours in a day, and every hour you and your team had to spend on chloroquine is an hour you couldn't work on fighting this virus. Yes or no, did the president's obsession with this issue distract you and others on your team from your mission of saving lives?
The directive we received to prioritize and put an expanded access protocol in place within 48 hours was extremely distracting to dozens of federal scientists who were focused on the coronavirus outbreak. They had to set aside all other work to try to put together this protocol in the 48-hour directive time period.
Yes or no, did it distract from efforts to prepare for this crisis, including securing PPE and ramping up testing and the production of other essential supplies?
It distracted from their efforts in developing other vaccines and drugs and that they were focused on at that time. It was a different group of individuals who were focused on procuring PPE.
Dr. Bright, just yesterday, the president questioned the testimony of Dr. Fauci when discussing children and schools. The president insisted that, quote, it has very, very little impact on young people. Dr. Bright, yes or no, do we know that the president's statement is accurate?
There's a lot we don't yet know about this virus, and it's really concerning over the last few weeks that we're getting more and more data out of New York and other places where they've had high numbers of infections of the impact of this virus in children. Is very different presentation and outcome in children that we see in adults, and it's very concerning, and we don't yet have an answer for that, but we should proceed very cautiously and not have any hope or knowledge that we know everything about this virus.
Dr. Bright, I want to end by quoting your testimony, quote, without clear planning and implementation of the steps that I and other experts have outlined, 2020 will be the darkest winter in modern history. The darkest winter in modern history. Yes or no, do you believe this administration is doing everything it can to prevent the darkest winter, and what more should they be doing?
I believe there's a lot of work that we still need to do. And I think we need still, I know, we need still a comprehensive plan, and everyone across the government and everyone in America needs to know what that plan is and what role they play. There are critical steps that we need to do to prepare for that fall, for that winter coming. We do not still have enough personal protective equipment to manage our healthcare workers and protect them from influenza and COVID-19. We still do not have the supply chains ramped up for the drugs and vaccines, and we still don't have plans in place on how we distribute those drugs and vaccines, and we still do not have a comprehensive testing strategy so Americans know which tests do what to do with that information, and we know how to find this virus and trap it and kill it. So there's a lot of work we still have to do.
Gentleman yields back. A pleasure to recognize the gentleman from Oklahoma, Mr. Mullen, for his 5 minutes of questions.
And I'm in the middle of transition, I guess you would say, between BARDA and the NIH.
So you've accepted the reassigned position to NIH?
Except that this position is under discussion at this point. I have not yet accepted that role.
So are you currently being paid?
I'm currently being paid.
Where are you being paid from? Out of BARDA or from NIH?
It's not completely clear to me, but I believe it's out of NIH.
So are you getting a paycheck since you've been over there since mid-April, right? Is that correct?
I've received one paycheck, sir.
What, from NIH?
I think it was still part BARDA and part NIH. I've had discussions about my onboarding process at NIH.
Are you, at BARDA, you made $285,000, is that correct?
That's true.
So how much are you currently making at NIH?
I don't think my salary has changed.
It's still the same? So you've been over there for approximately 4 weeks, a month?
It has been about 3 weeks since I was removed from my office at BARDA.
So have you reported to NIH yet?
I've checked in with the NIH director's office, and we've discussed the onboarding process, the fingerprinting process, and we had a call just last evening to discuss the framework of my responsibilities that they have envisioned for me at NIH.
So you haven't actually reported to work, but you're still getting paid, correct?
I've been on sick leave since I was pushed out of my position at BARDA.
Sick leave for what?
For a very high blood pressure, and I've been under treatment for my position.
For hypertension?
For hypertension, sir, yes.
So you're on medical leave?
I've been on medical leave. This week, however, I transitioned from that medical leave to annual leave so I can manage this.
What is annual leave? What do you mean? You're
vacation time. So
you're on vacation time right now?
I'm on vacation.
Did you inform your supervisors about you coming here today, or did you need to do that?
I have informed them about my leave status, and I've had a conversation with them last night.
So you transferred from medical leave to vacation this week, or does it start next week?
I had a conversation with my physician about my hypertension and how we've been managing it over the last 3 weeks, because this has been very stressful to be removed suddenly without explanation from my role and position. It's a life change for me. And my physician has been working very closely with me to manage my hypertension and stress. And the conversation I had with him last night indicated
I guess I'm kind of confused there, because you say you have hypertension, but yet you were able to do these interviews, you're able to make the report, and you're able to prepare for this hearing.
This guy's a genuine asshole.
You're too sick to go into work.
This is what we need to be talking about. We don't have enough N95 masks to keep the nurses and doctors safe and alive.
Is that correct?
And we're talking about
Sir,
what sort of vacation versus hypertension sick leave he's taking?
Sick to do that, but yet you can prepare for a 2-hour hearing. I just having a hard time tracking that. I have a hard time understanding that. And if you have hypertension and you're too sick,
you have a hard
to
time
NIH,
understanding anything,
but you
Mullen.
didn't ever experience that in BARDA, right? You never had issues in BARDA with hypertension?
I didn't have the level of stress of being removed from my position while I was in BARDA. So this has been very stressful. And my physician.
I get it. People handle pressure. People handle pressure quite different. But as a director of BARDA, I'd feel like you're in quite a bit of stressful position when you're trying to manage a pandemic, but you can't manage that, or you could manage that, but you can't manage your own hypertension when it comes because you got removed from the office. But yet you can still receive pay from NIH, but you can't show up for work. And then all of a sudden you can prepare for this, but you can't do that. I just have a hard time understanding it. I know you're a bright individual and very smart, but you are an employee of the federal government, and I just want to make sure you're not doing something to deceive the American people at the same time getting paid from the United States government. With that, I'm going to yield to our ranking member, Walden.
I thank the gentleman. Dr. Bright, your lawyer appears to have a pretty substantial binder there, and I know Mr. Guthrie asked about the documents that are on the table. Are those the exhibits to your complaint to the Office of Special Counsel?
I don't know what these are.
I'll direct it to the counsel then, since she's answered other questions. Are those the exhibits to the complaint to the Office of Special Counsel?
Some are, and some are my work product, and some are my notes, and they're not appropriate to turn over to Congress.
So is it appropriate to turn over the documents that are referenced in the complaint, not your work product, I respect that, to this committee? And would you do that?
You asked that question initially, and I said we would look at the documents to determine whether they are appropriate to turn over.
I'm just talking about the ones that we have partial email chains, we have screenshots of emails.
Again, his access to his email was cut off.
I think we should have the right to see those documents if we're going to effectively know the full extent of this complaint. And I just wish you would commit to turn those over. Dr. Bright, will you turn those over?
I think I addressed that.
Dr.
He already
Bright,
has.
I'm asking Dr. Bright now.
I've submitted my full complaint to the Office of Special Counsel, and that is the process I know to follow. So,
but you're here as an individual
The gentleman's
citizen,
time is expired.
whistleblower. We just want to see what you've submitted so we can evaluate it ourselves.
Yeah, so talk to HHS.
Process, other than I was supposed to submit it to the Office of Special Counsel, which I've done so. I don't understand the legalities of sharing that before they've had their opportunity to review that. And
they've certainly been shared out into the public and press. The Washington Post has them from some source. They look a lot like what's referenced in your complaint. None of us, I don't know where those came from, but other media outlets are certainly seeing them. I just think as part of
Gentleman's
this
time has
investigation,
expired.
Madam Chair, you should request them.
We will seek all information that's appropriate to be submitted to the committee. And what I circulated, or we circulated,
she's-
to
what-
all members of the subcommittee.
So this is so
were
ridiculous.
the
Everybody's wearing the
emails that
masks
were,
but not covering their nose.
Public, as well as the complaint. That's what was out there.
I know, but
Now, I haven't
any other
tracked daily who
investigation-
says what. I mean, maybe Politico has something too. I don't know the veracity of things
But in
like
any other, any other investigation, we'd both be going, say, we need to see all the documents as a committee. So that's all I'm after.
Yeah, but is he taking vacation
No, I
time
think that,
today?
I think we need to move on.
Because he's
The
not on
gentleman
vacation. He's
from
testifying. We need to
Oregon is
know these things.
recognized. Mr. Schrader.
Thank you. Thank you for being here, Dr. Bright. Really appreciate it. Tough to do. Very impressive that you're here. Could you describe the tone and reactions of Dr. Kadek and Dr. Azar at your January 23rd meeting when they had the all agencies meeting on the COVID virus? Could you describe how up to speed they seem to be?
In that meeting, sir, it was one of our first meetings that we had about how to address the outbreak. And because we had practiced, I came in with my list of needs, and those lists for money, people, and viruses. My request was met with a bit of surprise and puzzlement. I remember Secretary Azar looking around the room and saying, money, you need money, maybe there's money somewhere. I mean, it was just something that I could tell.
Despite the fact that we had the outbreak in China for some time.
This was January 23rd at this point.
Could you describe January 25th, if you remember, email exchange with Mr. Bowen on the mask situation?
I don't remember that specific, but I'm sure it was urgent. I'm sure that Mr. Bowen was sending me a notice saying, asking if this.
So you didn't ask him to come and talk to you. He just reached out to you.
Yes, sir.
Okay. How about an email exchange with Dr. Kerr on January 27th? Did you reach out to Dr. Kerr? Did he come and wanted to
Dr.
email
Kerr
you?
reached out to me, I believe. This was because, again, he is a pandemic influenza expert as well, response, and he knows the vital nature of needing those viruses, and he was involved in prepping our secretary for a call he had with the Vice Minister Ma in China. And we knew a high priority was for our secretary to ask for those viruses. We've had challenges in the past in getting viruses from China from avian influenza strains and viruses. So this was a high priority because we needed that to get started. And he was alarmed when he wrote to me that morning indicating that the CDC director had reprioritized and actually indicated we did not need, or he did not need to, the secretary did not need to ask China for viruses. And it was alarming to us because we knew how critical it was.
That sounds incredible of light of what has transpired since then. So I guess my major point here
Thanks
is
for the
that
update,
we
Larry.
have,
That's huge.
A brave individual coming forward as a whistleblower, but he is not alone. There are many other experts, scientists, and manufacturers that realized we were in, if I may say, deep shit, not a long time ago, long before the administration and the White House began to wake up. What do you think would have happened if Mr. Navarro had not reached out to you and actually responded to you? Where would we be now if you hadn't been able at least to get one person in the White House's attention?
It's difficult to speculate where we were. So even when Mr. Navarro reached out and strongly suggested action be taken on February 10th, and February 9th is in the email, February 10th, it was conveyed to Dr. Kadek that we needed to ramp up production of N95 masks. That order did not go out, that solicitation did not close till March 18th. So even with the pressure of Mr. Navarro, who I believe shared a sense of urgency about this outbreak, that pressure alone still did not spur Dr. Kadek and our strategic national stockpile into that urgently needed action.
Well, that's very disconcerting, and the reason we're here today, perhaps. Last question, if I may, and switching gears and going to the other side of the spectrum, while it's been hard to get folks' attention here in Washington, D.C. and the administration on the seriousness of this, I think most people now are convinced this is a very serious issue. And I'm a little concerned we're going too much the other way in terms of information. You alluded to it here on the vaccines. I think some people are under the impression there's a vaccine going to be developed in a couple of months and everything's going to be fine. I can go back to work. And we unfortunately have to juxtapose economic issues. They have to have realistic expectations at home. And you, I think, accurately indicated, well, it can take up to 10 years. And, the quickest we did, I guess, was Ebola, and that was, I believe, 5 years. So, is it tough question to ask? I suppose you don't have to answer. But I mean, I don't want America to think they can just not get back to some semblance of a new post-COVID life until a vaccine comes out, because that could take years. And there's a chance the vaccine will maybe not be as effective, much like our flu vaccines that, with the flu mutating year to year, sometimes. So I just want to make sure that ask you if you would agree that we can't wait to open up America entirely until a vaccine is there. We have to use some of the other parameters you've already suggested.
We have to make sure that we have some scientifically led and driven decisions on how and when it's safe to reopen America. If it happens before we have a vaccine, if we have a vaccine faster, that's great. But if we do need to open America up sooner, we need to make sure everyone understands the risk and understands the risk of their activities. And everyone has to play a critical part in following those activities to reduce the risk. We have to have a testing plan in place and enough tests to make sure that we know when people are exposed so they can be quarantined and isolated and not continue to infect others. And we also are developing a number of therapeutics that could offer some potential benefit prophylactically or protect you almost like a vaccine before you're infected. And those are being developed and maybe even faster than a vaccine. And if healthcare workers and frontline workers can use those therapeutics, then that might offer them some protection as well until there is a vaccine. So there's a number of steps in between now and a vaccine. I believe if we let science lead the discussion and we inform America of the risk and the clear guidance on what needs to happen and people follow that guidance, then there is a stepwise process to getting back to work and back out of our homes.
Great.
Gentleman's
Thank you very
time
much.
has expired. And he yields back. Pleasure to recognize the gentleman from North Carolina, Mr. Hudson, for his 5 minutes of questions.
Thank you, Madam Chair. First, let me say I believe any whistleblower should be respected and allowed to be heard. That is a core component of keeping our government accountable and running smoothly. But this hearing is not about a whistleblower complaint. It's about undermining the administration during a national and global crisis. That's evidenced by the fact this hearing is being held in the wrong subcommittee and well before the Office of Special Counsel finishes its work. To disregard the minority so spectacularly in the organization of this hearing only highlights the partisan and political nature of this hearing. I hope today will be held up in the future as a lesson.
It's a
of what not to
whistleblower
do.
who said, hey, we need to
and gravity
get
that
more
should be
equipment
given
and we
to
need to
whistleblower
get the
complaints
virus so
they're
we
not
can
abused
save
for
people's
political
lives.
expediency.
But yeah, that's
More
partisan.
importantly, though, we have vital work we should be doing. My constituents want Congress to get back to work. So I'm glad to be here to highlight the important work that needs to be done. I heard from an ophthalmologist in my district this week about the need for relief. She says she'll consider this year a success if her practice group even breaks even. Long story short, we should be examining the $175 billion authorized and appropriated in a bipartisan manner for providers and what providers still need and recommendations for moving forward. We should also be examining why there are gaps in outcomes and access for minority communities. Fayetteville, North Carolina, in my district, has a large and diverse community, and understandably, the folks back home are scared because coronavirus hits them hardest. Why are we not spending our time today examining this crisis within a crisis more closely? I hear from providers and hospitals about issues with PPE. I know this administration has done extraordinary things to secure more PPE. I want to thank President Donald Trump for his strong leadership. Not only did his administration move quickly to coordinate a response, but his travel ban on January 30th was a bold move, though it was panned by his critics as an overreaction at the time.
It was January 31st and it took place on January. Come on.
System they inherited. As you testified
This
earlier,
guy's an
we moved
idiot.
quickly to start
And he's
programs
reading
like
from a
Project
piece of
Air Bridge
paper. Get the
to expedite
facts
more
right.
PPE coming in. But questions remain about why there is a global shortage and what more Congress can do to support the administration's efforts to secure sufficient PPE. This committee should be working
Basically,
on that question.
Dr. Bright raised
We have
alarm
multiple
bells
pieces of
and was
bipartisan
completely
legislation
ignored,
waiting
and
to
then
be
they
considered to
kicked him
improve
out.
The operations of the Strategic National Stockpile. We should be examining why our stockpile was allowed to dwindle under previous administrations. The answers to these questions and solutions
And the 3 years of
to
this
timely
administration?
and critical to helping this
Remember how he
administration
said they
combat
stopped
this
having
virus
meetings in
and the deadly disease it
2017?
causes. I hear from constituents every day who are suffering under these stay-at-home orders.
I'm
This crisis
suffering
is
right
hard
now.
For anyone who, even if they weren't suffering from substance use disorder or mental health challenges before they were confined to our homes. And this crisis has exacerbated this problem. Why are we not examining access issues to mental health providers and the effects this crisis has had on our constituents' mental health?
That's a good idea.
Dr. Bright, you're no doubt
Why
an
don't you
accomplished
suggest
scientist, and I
that?
appreciate the service you've rendered this country. You deserve to be heard, and your whistleblower complaint should be given the serious consideration any whistleblower complaint deserves. But we also deserve to have the opportunity to ask questions about serious allegations that have been made against you. And I'll note again, this is not the time or place for that hearing. The time is after the Office of Special Counsel has completed its work, and the place is the Oversight and Investigations Committee. But Dr. Bright, building on questions from Mr. Walden and others, Politico released an article yesterday stating that your complaint left out a lot of information and context regarding agency decisions to acquire hydroxychloroquine. You chose not to elevate your concerns to the Office of the Inspector General, but instead kept selected screenshots that didn't include full context. Another example, the Wall Street Journal reported on an email today that seems to show that you were in support of acquiring and using hydroxychloroquine. Can you elaborate on what was missing from your screenshots and why you didn't elevate your concerns at any time to the Office of Inspector General?
So the early days of when I was aware of the hydroxychloroquine, we were interested in acquiring that drug for its use in a randomized controlled clinical study. Actually, when I heard from Dr. Woodcock that it's something that we should try to investigate in a randomized controlled study, I even reached out to a company that was licensed and approved to make that drug in the United States to see if they could donate that drug to the NIH to conduct those clinical studies. I was aware of other efforts that were ongoing to try to acquire some of that drug for its use in randomized controlled clinical studies. As long as it was going to be used at that time for those randomized controlled clinical studies, I thought we should look into the supply chain the same way I did with remdesivir. It was only after I learned that that supply that was being discussed was coming in from Pakistan and from India, from facilities that were not approved by the FDA, and the drug was not approved for use in the United States, that I became increasingly alarmed of having that drug in the United States. Second, it was when I learned that the plan was to make that drug available through an expanded access program so people could potentially get that drug and not be under the close supervision of a healthcare provider. That caused significant concern. It's because of that and the cascading days afterwards that we put in that emergency use authorization with the safety bumpers and barriers that we could feel comfortable with, that that drug would only be used under close clinical supervision. But in the earlier days, in that email exchange that you're referring to, was before we knew about this information in Pakistan, before we knew it was going to be used for expanded access protocol. It was when I thought our efforts to obtain some of that drug would be used at the NIH to conduct randomized controlled clinical studies. So I was relieved that we did identify some supplies of that drug for those clinical studies.
Jim, my time's expired, Madam Chair. I yield back.
The gentleman yields back.
Perfect answer. I was in favor of hydroxychloroquine
Mr.
in terms of taking a look at it to do clinical studies.
Dr. Bright, thank you very much for being here. And
It appears that a suggestion was made just to get the drug into over-the-counter use in the United States without
which means
doctors.
These numbers have increased. There's nearly 1.4 million cases diagnosed of COVID-19 in the United States and over 80,000 fatalities. Experts believe both of those numbers are undercount because after 5 months of this virus being on our shores, we still have a systemic problem with regards to robust testing. Is that right? Cases in many states across the country are still actually increasing in number despite that lack of testing. Is that right? You've mentioned in your testimony that, quote, we missed early warning signs and forgot important pages from our pandemic playbook. Is that right?
Yes.
Sir, you've been the head of BARDA since 2016, is that right?
Yes.
Until recently. Have you experienced any pandemics prior to this one over your course of time, either there or in your prior government service?
We responded to the Zika outbreak. We responded to the Ebola outbreak. They didn't rise to the level of pandemic.
Of course not.
But yes.
Right. Thank you for the clarification. Sir, you're aware at the end of the Obama administration, the Obama team put together a playbook to try to guide succeeding administrations on how to handle an outbreak, correct?
Yes.
Sir, you're also aware that there's a simulation done from an outgoing Obama administration in January 2017 with an incoming administration about how to respond to a pandemic. Is that right?
Yes.
And you're aware that the Trump administration cut the number of CDC staff located in China from 47 to 14. Is that right?
I don't know the exact number. I know it was reduced.
Okay. And sir, you referenced already the simulation called Crimson Contagion. That was a simulation done by HHS and begun in January of 2019. Can you shed just very briefly a little bit of light as to what the findings of Crimson Contagion were?
The significant findings, it was actually, participants were beyond HHS and covered broad areas of government and federal and state and locals. Some of the significant findings were the need for improved coordination and communication and alignment between the federal and state and local tribal territorial governments, and the significant need for personal protective equipment and the shortage, and a significant need for funding initially.
And sir, that simulation was based off of a flu-like virus that was initially detected in China, spread by global air travel, and resulted in the infection of 110 million Americans, leading to 7.7 million hospitalized and nearly 600,000 dead. Is that right?
Yes.
Sir, when did you first have concerns about the potential impact of COVID-19 on the United States?
In early January.
And were you aware that your supervisor, Dr. Kadlec, suggested that the activation of the Defense Production Act in mid-January?
I wasn't aware of him doing that, no.
Okay, well, you mentioned that you had 2 meetings with Secretary Azar. I'm sure you had others, but you referenced so far in your testimony meetings on January 23rd and 27th, where you raised concerns directly to the Secretary. Is that right?
Yes. And the Secretary was not at the second meeting. Deputy Secretary Hargan was there.
Thank you. You're aware that top National Security Council staff, including National Security Advisor Mr. O'Brien and his deputy Matthew Pottinger, raised significant warnings that China was downplaying the impacts of this virus.
I did learn of that in the meeting at the White House, yes.
You're aware that we sent 17.8 tons of medical supplies to China in early February.
I've learned of that.
Are you aware that the Trump administration budget proposal released in February of 2020 called for a cut to CDC by nearly $700 million?
I'm not aware of that. I've heard of it.
Are you familiar with a memo written by Peter Navarro that warned of the impact of the virus?
Yes.
Are you aware that it was spread among senior administration and White House officials?
Yes.
Are you aware that it was on or about April 2nd when the Trump administration finally activated and expanded the Defense Production Act, months after being warned by you and other senior administration officials?
I've learned of that.
Are you aware that that order itself did not extend to the full authority of the DPA and left a haphazard allocation process to states and hospitals to compete against each other?
I don't know the details of that authority, sir.
Has the Coronavirus Task Force actually developed a plan for reopening the country? I'm
not aware of the full plan to reopen, sir.
Have they developed some principles that the White House has touted as some principles or guidelines as to how to reopen the country?
I've heard of some principles.
Are states following that plan?
It doesn't appear that there is a nationwide coordinated plan that states are following, sir.
So after this recitation of the actions and inactions of this administration over the course of the past 6 months or so, can we possibly say that this administration has prepared our country for the moment that we are in, and how we could possibly be prepared for the distribution, development, manufacturing, and distribution of a vaccine to try to address 330 million Americans over the course of the months ahead?
I think we have a lot of work to do to be prepared, sir.
You
I
are
don't think
too
we're
kind.
fully prepared.
Thank you, sir. Yield back.
Gentleman yields back. Pleasure to recognize the gentleman from Missouri, Mr. Long, for his 5 minutes of questions. Okay.
We can go to Curtis.
Should we go to? You want to pass?
I think we're going to reserve, yeah.
Okay, you can reserve, and we'll go to the gentleman from California, Mr. Cardenas, for his 5 minutes of questions.
Okay. Thank you, Dr. Bright, for being here today, and I just want to tell you that
my family, my community, and myself, we appreciate your 25 years of focused service, specifically when it comes to addressing pandemic outbreaks. And it's my understanding that you've spent those 25 years leading teams of scientists when it comes to drugs, diagnostics, and vaccine development. And we appreciate that. When an administration or decision makers prioritize politics over science, does that tend to increase or decrease the likely results of the loss of life in the middle of a pandemic?
I believe the scientists are best equipped to understand how to manage a public health crisis, and I believe scientists should lead.
And therefore, to my question again, I'll phrase it differently. If the scientists are not leading and the politicians are leading with the final decisions when trying to address the issues of pandemics that are taking people's lives, that way of handling it, does that likely increase the loss of life, or is it likely to decrease the loss of life?
I believe the scientists leading will actually increase the likelihood that we can survive this pandemic and move through it. So if scientists are not allowed to lead and speak up, I believe it could increase the loss of lives.
Thank you. How many times in your career have you personally, actively said, I need to enact my right to be a whistleblower?
I'm sorry, could you repeat that?
How many times in the last 25 years have you decided to enact your right to be a whistleblower?
This is my first time, sir.
Okay, I knew that answer was simple, and I think I confused you because I made it so simple. And the reason why I want to say that is because I believe that you've been incredibly consistent in your willingness to dedicate yourself, your expertise, and your career to saving lives. Is the loss of life on your mind? Was that on your mind when you decided that you needed to enact your right to be a whistleblower?
I've spent my career focused on saving lives, and sir, everything I've done to come forward now is to raise awareness of challenges we have, things that are not getting done, because I do think it will save more lives.
Okay. Are you aware of the fact that the lack of testing in the United States of America is affected by many pieces of the puzzle in order for people to get testing, whether it's swabs, whether it's N95 rated equipment for the caregivers to be able to enact safely with the public? Are those all factors that have contributed to our lack of having adequate testing in America?
They are factors, sir. I don't think anyone has thought through the entire plan completely to understand those critical components for testing. I think there's a lot of confusion about the different types of tests, and I think our national narrative is focused on a number of tests, and it's not about the number so much as the right types of tests, and Americans know how to use them and what they do with that information. And no one has really thought through the raw material supply chain to make sure we can sustain the need to test.
Okay, that sounds a little confusing from somebody who actually has been working at a high level of the United States government in this space that we're discussing at this moment. So my question is, if we are not implementing in this pandemic to the degree or ability that the United States should or could, what's contributed the most to that? Was it the lack of scientists recommending up the chain of command, or was it the people at the top of the chain of command deciding to do things differently than the scientists are strongly recommending?
There's evidence of scientists raising concerns about shortages and other actions that are important to take that were not being taken. Is a different level. In my personal situation as the leadership at HHS, and I asked for Dr. Cadlick, that I believe was dismissive of the early warnings that I was raising.
Okay, and you said early warnings, and despite the early warnings, have there been other examples where warnings and strong recommendations were either being ignored or set aside and other actions were taken?
So I believe that I've learned of others. I mean, the CDC has written several guidelines for reopening America and getting people out of their homes and back to work. And I'm not sure if all of those guidelines have been reviewed or being publicly considered at this point. So there's another example of, I think, really hardworking career scientists and their information and their hard work not probably getting the proper vetting and proper exposure to the American public.
Well, one of the things, I have no idea how much time I have because the clock's been flipping back and forth, but hopefully I have a little bit of time. We've heard boasting from the White House about millions of personal protective equipment, PPEs, as everybody knows them as. Millions have gone out to America. But fact, to date, we should have had billions gone out throughout America. Isn't that the disparity?
There's a huge disparity, and healthcare workers are having to compromise their protection and their health and safety because they're having to be creative and reuse a single mask for the entire week or come up with novel sterilization practices that are not proven or tested yet. So that disparity actually is impacting our frontline workers, and those are the people whose lives we really need to preserve so they can treat others.
I have family members who are working in hospitals today on the front lines who have been telling me that they are wearing equipment for days at a time that they're supposed to be disposing of several times a day.
Gentleman's
and they're
time
having
is,
to use them over and over.
expired. I
Thank you
the
very much,
gentleman.
Madam Chair. And if somebody could do a better job of the clock,
Yes.
I'd appreciate it. It kept flipping back and forth. I was trying to.
You're absolutely right. It got stuck at 4:44, went to 0, and popped up to 1:21, so I'm watching too. My father was a watchmaker, clock repairman. Where is Daddy when we need him? A pleasure to recognize Mr. Long from Missouri for his 5 minutes of questions.
Thank you, Madam Chairwoman. And Dr. Bright, you contend that your removal was because the Trump administration and HHH leadership in particular lacked scientific integrity. Do you think that Dr. Fauci lacks scientific integrity?
Sir, I don't think my removal has anything.
It went to Billy
associated with
Long,
Dr.
and I'm like,
Fauci
that's a
at all. I
Republican.
think my removal is because of tensions and actions I took between my supervisor, Dr. Cadlick, and myself.
Do you know about Dr. Fauci's testimony 2 days before at the Senate Health Committee?
I'm aware of that testimony, yes.
If HHH leadership is so hostile to scientific integrity, as you say, as you allege, how do you explain Dr. Fauci being allowed to testify forthrightly, to serve in a prominent role on the White House task force, the administration, and direct NIAID's extensive research efforts?
So I'm not sure what decisions are involved in allowing Dr. Fauci to testify or not. That's not something.
Can you please explain something
sure.
which you
I'm
have
not
nothing
aware
to
of
do
what
with?
process or
I'd like to
decisions are
hear your
involved in
explanation of
allowing
that.
Dr. Fauci to testify or not. I'm not
But he
involved.
was allowed to testify.
I know he was, but I thought I understood you to ask me if that was appropriate or if he was not being allowed to. Maybe you can repeat your question if I misunderstood it.
Okay, what I'm saying is you're saying HHS is hostile to scientific integrity. And if that's the case, can you explain why Dr. Fauci was allowed to testify forthrightly in the committee? If they're hostile to, why would you let him come out and testify without any no holds barred?
I'm saying that my supervisor was not following proper scientific process that we have in place for BARDA. I'm not actually saying the administration is hostile against scientific integrity in all cases. So I'm saying in my particular situation, as in my claim, my supervisor was conducting an inappropriate activity that was going around proper scientific vetting. That is what I put in my claim.
Why did you not bring these concerns to Secretary Azar or his chief or the Inspector General? Why did you not bring any of them into the loop and say, hey, I have these concerns?
Sir, I believe some of the activities were not isolated with Dr. Cadlick. I think some of his senior staff was also aware of some of the processes that were being utilized to go around our traditional review process, scientific review process.
But wouldn't normal protocol in any situation be that you go to the secretary of HHS or his chief of staff or the inspector general with your concerns instead of just gathering them up and deciding that one day you're gonna?
Well, I didn't decide that. I was pushed out, sir, and involuntarily transferred without my knowledge.
But you had these concerns, so why didn't you take them to your superiors when you had the concerns? And maybe none of this, maybe we wouldn't be here today.
He's just spent an hour saying that he did take his concerns and they were ignored, and then he was transferred out.
I think it was in 2018 that they look into what I believe was inappropriate pressure, political pressure on some of our contracting activities in discussion about procurement integrity. And I do not think that that was ever followed through on. So
Did you bring your concerns to the Inspector General?
I do not believe they were followed up through and submitted to the Inspector General. I raised those concerns to our HHS.
But you personally didn't talk to the Inspector General, didn't raise the concerns with the Inspector
No,
General?
because that's not part of the procedure that's supposed to be followed, but
I raised
okay.
those with the Secretary's Office of General Counsel. They were present in that meeting, sir.
I'll take that as a no. Okay. You state in your testimony that HHH leadership was dismissive about your predictions about the broader outbreak and the pressing need to act. However, it's my understanding that it was Dr. Redfield at CDC who alerted the White House's National Security Council about the risk.
Did he say
of the
HHH?
virus on January the 2nd, and a high-level team with the NSC's Counterproliferation and Biodefense Directorate quickly began meeting to address the possibility of a pandemic. Do you consider Dr. Redfield's actions here to be dismissive about the threat of a coronavirus?
Sure, people were aware of the urgency. What was lacking was the action and how to address the urgency. So when we were raising issues on critical supply chain of medical equipment to protect doctors and nurses, if they're aware of the urgency of the situation and still failed to act, I think that is even more unconscionable than not being aware of the emergency and not acting.
Yeah, thank you for proving the point, Mr. Long.
I would recommend that if you have issues, you might go to the head of the department, his chief, and some folks like that. I yield back.
Like I did. Thank you very much.
Gentleman yields back. Pleasure to yield.
Is it a pleasure, though? Is it really pleasurable?
Thank you very much. Your job, our job, is to protect the American people. And this fierce virus can be managed if done correctly, correct?
I believe so.
And in fact, the playbook is established. It's testing, contact tracing, and then isolation, starting with first social isolation, correct?
Yes, those non-pharmaceutical interventions and testing are critical first steps.
Right. And in fact, this virus is across the world, and many countries that have followed that tried and true protocol have done far better than the U.S. Is that correct?
We have seen differences in the response and the outcomes of that response around the world.
I'll go through some of those. And, you know, the Johns Hopkins study that said that the U.S. had the best preparedness, it turned out we have the worst response, correct? With the most cases and the most deaths.
We have the most cases and the most deaths.
And I did some calculations. You know, on January 19th, South Korea determined its first case. On January 19th, the U.S. determined its first case, correct?
January 20th was the U.S., yes.
All right. And if we had the same response
technically
as
the
South
same
Korea,
day, because South Korea is
by population
over there.
They had 33,000 deaths. That would have
actually technically not the same day, but actually the same time.
In Taiwan, they had the same virus, 22,000 deaths, and again, adjusting for population, that's 60,000 more deaths we've had here. Singapore, 82,000 more deaths. New Zealand, 65,000. The question for us here and for the American people is why? When we had the best plan, we had the worst execution. So let me go through a few things that you've established. One, beginning in January, before that first case here, FDA Chief Hahn asked the HHS if he could start contacting companies about possible shortage of protective equipment, and he got blown off by HHS, correct?
And I understand.
And on January 18th, before our first case, you pushed Dr. Kaldek to convene high-level meetings about the virus, but that was initially rejected, correct?
True.
And then on January 23rd, you demanded urgent access to funding personnel and clinical specimens to develop life-saving medicines. But you were told that the spread was under control, correct?
There wasn't a shared sense of urgency.
On January 25th, you warned others in the administration there's a critical need for procuring surgical masks. That was ignored, correct?
True.
On January 27th, you participated in the daily COVID-19 meeting where you expressed frustration with the slow pace of accessing virus samples and clinical specimens from China. You were reprimanded and you're no longer part of those meetings. Is that right?
That's true.
So you and others actually were seeing over the horizon what was coming to our shores, even before our first case was confirmed, correct?
We had spent many years preparing for a pandemic, sir, and we understood the threat. We understood what we needed to do.
Exactly. It's knowable and it's manageable. It's fierce and fearsome. But what you have to do is established. Is that more or less correct?
Yes, sir.
We just didn't do it. February 25th, President Trump gave an assurance that the stock market is starting to look very good and the coronavirus was very much under control. Were you aware of any medically involved people who had the view that the virus at that time was very much under control?
No, sir, I don't think the virus was under control. I don't think many people would agree with me in the scientific realm.
Now, in those countries I mentioned, it includes Germany, Taiwan, New Zealand, South Korea, Singapore. The leaders of those countries accepted that there was a role only the nation could play, and the provinces would have to depend on them for that. And I want to go through some of those things. One, establishing a testing protocol. Was that done here?
No.
Two, acquiring and allocating and distributing the personal protective equipment to where it was needed, when it was needed. Was that done here?
No, sir.
In fact, we had governors and hospitals competing with each other to try to get desperately needed equipment. Isn't that correct?
There's a lot of confusion, a lot of competition, and bad decisions made to acquire poor quality product.
Right. In any of those other countries that I just mentioned, are you aware of the leader of that country at a press conference making recommendations on what kind of medication people should use?
I don't know the details of what happened in those countries, sir, so I don't know.
All right. Now, we had governors here, Republicans and Democrats, Republicans like Hogan, like Phil Scott from Vermont, who have done a tremendous job. But no matter how good they do their job, can they protect their people without the aggressive intervention of the federal government playing its role?
I think the federal government plays a critical role in coordinating and aligning and making an equitable distribution of those critical supplies. I believe that's what we'd practice and exercise in the past, that there would be a critical role for the federal lead in coordination at the state, local, and tribal and territorial levels.
Thank you, Dr. Bright. I yield back.
Gentleman yields back. Pleasure to recognize the gentleman from Georgia, Mr. Carter. Do you wish to question, or do you want to pass? You reserve, okay.
Good.
Gentleman from California, Mr. Ruiz, is recognized for 5 minutes of questions.
Pass.
Dr. Ruiz.
Thank you, Dr. Bright. Thank you for your testimony here, and thank you for your service to our country.
We're at the point where we're not learning
My heart
anything new
aches
now.
for the family and friends of the over 80,000 in America who have died of COVID-19 in such a short period of time. In fact, my heart aches for those closer to me. The Riverside County has reported 228 deaths. As a doctor, I appreciate your written testimony that states that science, not politics or cronyism, must lead the way to combat this deadly virus. There's been a lot of hype about cures for COVID that have been shown to be ineffective and even dangerous. We are now seeing the very real dangers and consequences of not making decisions based on science. Hydroxychloroquine, which Fox News commentators and then the White House repeatedly touted and actually encouraged people to use, is Exhibit A on this list. But there is one drug that appears to provide some therapeutic benefit, remdesivir. 2 weeks ago,
Remdesivir.
Dr. Fauci announced that remdesivir showed a clear-cut, significant positive effect in diminishing the time to recovery. My understanding is that in January and early February, you launched a comprehensive review to assess which existing drugs may prove a therapeutic benefit, and you quickly identified remdesivir as the most likely drug to be effective against COVID-19. Can you describe how you came to that conclusion, who you told within HHS, and what the response was?
Yes, sir. That conclusion came about by a technical review from a number of scientists within HHS, the CDC, FDA, NIH, and BARDA. But it was also aligned with a scientific assessment from WHO and a number of global experts who rapidly looked at every potential drug and ranked remdesivir as the drug that had the most potential for benefit.
Who did you tell, and what was the response?
We shared that information with Dr. Kadlik. We shared that information within HHS leadership as well. We had discussions about the actions that could be considered for acquiring the limited supply of remdesivir.
So what was the response?
And we had discussions about how to ramp up production of more remdesivir in case the randomized controlled clinical study that the NIH was conducting came through with positive.
And so you had a discussion, and what was the response? Did anything happen?
No decision was made at that time.
My understanding is that Peter Navarro, the White House trade advisor, reached out to you on February 7th to seek your counsel. You told him about your top 3 concerns: the shortage of N95 masks, the need for a quote-unquote Manhattan Project to develop vaccines, and securing adequate supplies of remdesivir. Can you tell us if Mr. Navarro agreed with you and what steps you and he took?
Mr. Navarro did agree with me on the remdesivir, the N95 mask, and the Vaccine Manhattan Project, and he drafted a memo on February 9th to the White House Chief of Staff and Mick Mulvaney to share with the White House Task Force.
The directive for HHS to act on remdesivir occurred on February 10th. What happened next? And did the department promptly procure the needed supplies of remdesivir?
We did not proceed with procuring any supplies of remdesivir.
Okay. You were removed from your position on April 22nd. By the time you were removed, had the department settled on a plan and procured the remdesivir?
No, sir. They were still discussing slide presentations about potential donations of remdesivir at that time.
So what you are describing is a gang that couldn't shoot straight, and yet we are in the middle of a pandemic. There is one drug the experts say could make a difference, and in fact has been shown to make a difference, yet the department can't seem to figure out how to acquire it. A week ago, the Washington Post published an article on the rollout of remdesivir, describing it as, quote, confusing, unfair, and marred with incomplete medical information, unquote. Doctors described how they can't obtain the drug and don't understand the process for accessing it. Dr. Benjamin Linas from the Boston Medical Center said, quote, there's no transparency. The process is just a staggering injustice. Dr. Bright, you were warning about this over 3 months ago. If the department had listened to you and the other experts at your agency, could this fiasco have been avoided?
February 7th,
We
originally.
had a plan, sir. We should have had a plan for that drug and any other drug.
I mean, really, we could fix all this by putting Jared in charge.
Right.
Here's what I don't understand. You were right about the dangers of hydroxychloroquine. You were right about the benefits of remdesivir. You were right about N95 masks and other critical issues. Yet you got fired from your job while officials who botched the response and ignored your warnings stay in theirs. Not only is this unfair to you, it's completely dangerous to the American people. I yield back my time.
Has Raul never been to Washington?
Gentleman yields back. I'd like to clarify something just very quickly relative to your leave, Dr. Bright. Are you on accrued vacation time now?
I'm sorry.
Are you on accrued
Fix
vacation
your
time now?
mask.
I'm on approved vacation leave today, yes. I talked to that.
And would you be willing to share the exhibits?
Oh, she did.
Once
Okay.
you personally,
Well, I've made a difference.
Once you remove personally identifiable information.
I'm having trouble understanding you through the mask.
Oh, I'm sorry.
Oh, Jesus. No, you're not.
Wearing a mask,
We
I
can
thought I
understand.
had
You
it
can
on.
understand
Would
her.
you be willing to share the other exhibits once you remove
We're all gonna die.
personally identifiable information?
Yes.
Thank you. All right.
Chairwoman, we will make them available after the hearing today when we've had a chance to review it.
Thank you.
Well, Madam Chair, will they be made available to the minority as well as the majority?
Be made
Yeah, duh.
available to the entire committee.
Perfect.
We've never shared anything with the majority that hasn't been shared. This is a bipartisan issue.
But the
Madam Chair, if
conspiracy.
there's anything in those exhibits that hasn't already been released.
Okay,
to
she
the
put the
public
mask
that might be
back on
degrading,
properly,
would that be
so
kept
good.
in, confidence amongst committee members?
I'm sorry, I didn't hear you.
Well, I was
Not
talking,
knowing
I'm
what's
sorry.
in the emails, I'm wondering if there's any information in there that might be deemed to be degrading, would that be kept in confidence amongst the committee members as opposed to being released to the public?
Degrading to whom?
We'll follow the rules.
And that is
cover
in
that.
compliance with Rule 11. Thank you.
Thank you, sir. Okay,
Degrading.
I now have the pleasure of recognizing
Enjoy lunch,
the
Lori.
only pharmacist in the United States
Time is it?
Congress, Mr. Carter.
Thank you, Madam Chair. Thank you, Mr. Dr.
God,
Bright, for
3
being here.
hours
Thank
of this
you for your
already.
service to our country. And before I begin, let me extend my condolences to those 80,000 plus who have lost their lives and to their families as a result of this pandemic, and a shout out to all of our healthcare professionals, as well as our other essential workers who have put their own health in danger in order to provide services to our citizens. Dr. Bright, it's my understanding that in 2017, BARDA funded a project with Applied Research Associates of Albuquerque to develop respirators that could be sanitized and reused during public health emergencies such as what we're going through today. However, according to recent reports by the Washington Post, none of these next-generation respirators are available for us today. Why is that? Do you have any idea?
I'm not aware of that. So you're talking about the ventilators, sir, that we developed? Or?
That's correct. I'm talking about those that were developed.
He said respirators.
That were developed and could be sanitized and reused during public health emergencies. It's my understanding that that was contracted and that that project was scrapped.
Sir, I'm not familiar with that project, re-sanitize the respirators.
You're not familiar with that project, and you didn't sign off on that project to your knowledge?
I'm not familiar with that project, re-sanitize respirators.
Okay, fair enough if you're not familiar with it. Let me ask you this. We've had a lot of discussion today about hydroxychloroquine, about chloroquine, and I'm a little bit confused here because it's my understanding that this is what BARDA, do you want to clarify something here? I see you. Okay. It's my understanding that that's what the role of BARDA, the mission of BARDA is to look at things like this. In fact, when we in Congress allocate money to go toward this, that you are supposed to be looking, that BARDA is supposed to be looking at things that could possibly have merit, such as hydroxychloroquine and chloroquine. And early on, it appeared that you embraced that. And early on, it seemed that you were in favor of looking at that.
Yeah.
And I'm just wondering, because of this
Because
pandemic,
studies.
because we didn't have any vaccine or any kind of agreed upon treatment, we should be testing, and that's what we are appropriating that money for. Would you agree with that? That that's what we are trying to do, is to look at what could possibly work and work with public companies to try to
Did Buddy just
to encourage
show
them
up?
to come up with
Is
those
this-
kind of solutions?
Absolutely. We should look at all options and make sure we evaluate the potential risks.
He thinks he's being clever right now, though.
Those in the context of a randomized.
He's sitting there,
controlled
I'm
clinical
fucking
study.
Matlock.
In the context of an emergency, we should move swiftly and get that clinical data as urgently and quickly as possible. But we should not proceed recklessly without that clinical data on its potential adverse events.
Is there not a chance
So
that
you're
bleach could
referring
cure
to
the
saying we should
coronavirus?
not proceed adversely.
You're right, Chris.
You're referring to hydroxychloroquine and the chloroquine?
We were promoting the standing up of randomized controlled clinical studies at the NIH with hydroxychloroquine. I worked with a company to even ask if they would donate drug to the NIH to be used in the context of a randomized controlled clinical study.
Right.
Yes, so that is what BARDA would do.
And in fact, I think you worked with the FDA to get an emergency use for hydroxychloroquine. Is that correct? And it was actually approved by the FDA.
That was in the context of the directive we received from the Secretary's office to stand up an expanded access protocol. Our clinicians.
So are
worked
you
with
saying
the
you
FDA.
were instructed to do that and you did it against your will, or?
So we were instructed to put in place an expanded access protocol. So in the context that Americans will be able to access this drug and not be under the close supervision of a physician. The scientists at FDA, NIH, CDC, and BARDA work together to change that directive to the context of emergency use authorization with guardrails in there so patients would be under the close supervision of a physician.
Understood. Let me ask you this. Initially, you appeared to be encouraged by what could possibly be a result of the effect of hydroxychloroquine. When did that change? When did you sour, if you will, on the use of hydroxychloroquine?
Asked and answered.
We've seen many
Pay attention.
drugs that could have benefit, and some of these are really interesting things we'd never heard of, some we have.
I understand that, but my question was, when did you sour on it?
When it was determined that this drug should be made available to Americans outside the context of a close physician supervision. So I supported conducting a randomized controlled clinical study for hydroxychloroquine at the NIH. When I learned that there is a directive to make it more broadly available, not under close supervision of a physician, I was...
When was that? When did that directive go out?
That was March 23rd.
March 20, and that's the time that you decided, no, this is not what we should do, and we should not be looking at hydroxychloroquine at all.
I didn't think that was the proper, safe way to evaluate that drug in the context of this outbreak. I believe that should be only done under close supervision of a physician. When we put the EUA in place that locked this drug down to only be used in patients under close supervision of a physician, we were satisfied we had those guardrails in place. When an email string followed a week later saying, ignore the EUA, push this drug into the retail pharmacies in New York and New Jersey, that's when I became more concerned.
And who put that directive out?
Without doctors' approval.
Who put that directive out?
Gentleman's time has expired. You can answer, Dr. Bright.
Which directive, sir?
That it should be put out to the public without physicians approving it.
That directive was an email string that had a number of individuals on it, and I believe it first came from Dr. Giroir, the Assistant Secretary of Health. It indicated the White House was asking for that drug to be more broadly.
So was it because the president was encouraged by the use of this drug that you became discouraged by it?
It had nothing to do with politics, sir. I wanted to make sure that Americans were aware of the risk of this drug. It was only available under very safe...
But it is a drug that is indicated and has been used safely in the past.
By almost 1.5 minutes. You can finish your answer, Dr. Bright, and then we're going to move to the next member.
The drug had been used safely for malaria for a number of years. We didn't have a database or...
But it's being used in the same dosage as it was.
Gentleman's time has expired.
Please.
Let him answer the
that,
question.
I'm overly generous with both sides of the aisle, but I think that we need to move on. I mean, 2 minutes of extra time is 2 minutes of extra time, and I'm not going to ask that it be
Let him finish,
over here.
though. Let him finish. Let the witness
gentleman's time
finish.
has expired. It's a pleasure to
Let
recognize
the witness
gentlewoman
finish.
from Michigan, Ms. Dingle, for her 5 minutes of questions.
Thank you, Madam Chair. Thanks you to both you and Ranking Member Dr. Burgess and Dr. Bright for your being here today. You're doing a great service. I think we're here today because COVID is real. I share the sentiments of many of my Republican colleagues that have expressed the thanks to the frontline workers asking questions. I want to look at the last few months. COVID's really real in my state. Michigan's the 10th largest state in the country, and we were third in the number of cases for weeks. We were third and remained there until this week in the number of deaths. We managed to move to 4th place 2 days ago, which is not a number anybody wants to be. My family alone, a cousin woke up with 104 temperature and was dead that afternoon. There are people still dying every single day. I have lost someone I've known. Sunday, Monday, a brother-like friend to me, Tuesday and Wednesday. And then we hear the scientific experts, yourself, but Dr. Fauci, other scientists around the country saying to us, if we don't listen to them, we could begin to see, well, we're going to see a return. You call it a dark winter. I call it, I don't want to see any more spikes. I don't want to see anybody else die. I am losing too many friends that I know, and people across the country are. So I want to focus on an area that's not your area of expertise, but it's mine, car safety. We expect our cars to be safe, and we expect car manufacturers to be responsible in making sure defective cars aren't sold. And if they fail in that responsibility, we hold them accountable. If an engineer in a car company realized a model had serious defects and warned her management about that, we would all think she had done her job responsibly. And if management ignored her and our committee found out, I will bet you right now we would be having hearings. And if Americans died driving those cars, the companies would be sued and they would be charged with criminal negligence. In fact, several years ago, before my time, this committee investigated airbag defects and vehicle safety. At the time, the subcommittee's ranking member, Dr. Burgess, said, there is no room for going slow when it comes to safety. And certainly, deception cannot and will not be tolerated. Dr. Burgess was right then, and our car makers have to be accountable. But what I'm concerned about is that we aren't applying these same standards to coronavirus. And I want to learn from what's happened so we keep that dark winter you're talking about from happening. It seems to me, Dr. Bright, you acted the same way the auto engineer I mentioned should act. You identified serious problems and then suggested fixes when it came to diagnostics, N95 masks, other equipment, and medicines. Is that right?
That's true. And Congressman, we still have those challenges.
Do you believe if your suggestions were implemented, lives would have been saved and the severity of the pandemic might have been lessened?
I believe lives would have been saved if we had proper medical protective equipment for our healthcare workers. Yes.
So people died because you weren't listened to?
People died because they didn't have appropriate protective equipment to save their lives and protect them from getting infected.
The problems aren't limited to just ignoring your advice. The American people are confused, given mixed signals, and quite frankly, some days just simply deceived. Let me give you an example. There was a visit to the CDC on March 6th, and at that visit, the administration said, anybody who wants a test will get a test. Was that true then?
There still are not enough tests.
So even this week, as we're being told, anybody who wants a test can have a test. Is that true in the United States of America?
No.
In fact, all the experts say we are doing is only a small fraction of the tests we need to do to reopen safely. I'm running out of time, so let me ask you about vaccines. We keep being told by the White House that we've heard very soon, quick numbers, a matter of months for that vaccine to be developed. This is your area of expertise. You are a top immunologist in the world. Was there any scientific basis to suggest in March that we'll have a vaccine in the next few months?
There's a lot of optimism. There's a lot of hope, but that doesn't make a vaccine. There's a lot of work that needs to be done to make a vaccine.
Will we be able to vaccinate people in the next few months?
It's very unlikely.
Thank you, Doctor.
Gentlewoman yields back. It's my understanding the minority is passing, reserving. With pleasure, I recognize the gentlewoman from New Hampshire, Ms. Custer.
Today, I want to thank you for your courage, for helping us to do our job to protect the American people. I want to start today by restating what I said at a hearing February 26th with Secretary Azar, right here, right at that table. The key to a public health crisis is trust and credibility. On that day, I urged Secretary Azar to provide clear, credible updates from this administration to the American public. However, your whistleblower complaint and testimony today unveil unheeded warnings about personal protective equipment, testing supplies, and vaccine supplies. Over the past several months, I have held countless conversations with doctors and nurses and hospitals and community health centers and our Republican governor and every other person in New Hampshire trying to get access to personal protective equipment, to protect our frontline workers, to protect our grocery clerks. We've been trying to get testing supplies, and we were told that because we were not a hot spot, we were on our own. And we literally had to turn to entrepreneurs, thank God they exist, and thank you to them for flying to China and bringing us the equipment we need that should and could have been distributed had we planned ahead. These conversations have informed my roadmap to recovery on how to safely reopen our economy. And key to those efforts is adequate testing, contact tracing, supported isolation, and vaccine development, your specialty. So I want to focus on your role as Director of BARDA in vaccine development and distribution. On page 28 and 29 of your addendum to your complaint, it states that BARDA estimated that between 650 million and 850 million needles and syringes would be needed for a vaccine to be administered here in the United States, for everyone to be safe. Your team at BARDA also estimates it could take up to 2 years to manufacture these vaccine delivery supplies. To your knowledge, Dr. Bright, at this time, has the administration placed any orders to prepare for how a vaccine will be delivered when one becomes available to every American?
I learned that they placed an order, the first order for needles and syringes on May 1st, and another order was placed today.
And were the amounts adequate?
I believe that it's for 320 million needles and syringes.
And could you please describe the situation if every American does not have access to the vaccine due to a supply shortage?
That situation would be catastrophic, honestly. The decisions have not been made yet, who to vaccinate first, how to identify those individuals, and how to stretch those limited supplies appropriately. And it's important to remember that it's not just the United States. So there's limited supplies. When I said it would take 2 to 2.5 years to make those, that was assuming there wouldn't be global competition for those limited supplies. Those are not made in the United States, some of them. So
does a lack of preparation in vaccine supplies make us more vulnerable to future spikes in COVID-19?
Absolutely.
And do we have enough supplies to distribute both the flu vaccine next winter as well as the coronavirus vaccine?
It's going to be extremely challenging.
Do we know yet of the interactions of the full-fledged flu season in combination with COVID-19?
We haven't seen that yet. Luckily, in this spring, flu was winding down when COVID-19 was emerging.
And without adequate supplies to vaccinate all Americans for COVID-19, does this slow down the goal of fully reopening our economy and getting back to the normal that every American wants?
It certainly brings caution and a significant consideration that must be taken into consideration before reopening. We need to make sure that not only the guidelines for reopening are clear to each individual, and each individual follows those guidelines. Otherwise, it puts us all at risk.
So can I ask you a question? And I know you're not political, and certainly we are all trying not to be political. In fact, I'm very proud in our state that our delegation and our governor are working so well together. But Dr. Bright, does this virus give a damn whether a patient is Republican or Democrat?
No, it doesn't. This virus just wants to infect people, and unfortunately, a lot of those people get really sick, and many of them die.
Thank you. I'm so grateful, not just for your knowledge, for your humility, and for your service to our country. Thank you, and I yield back.
Thank you.
Gentlewoman yields back. Minority reserves. Pleasure to call on the gentlewoman from Illinois, Ms. Kelly, for her 5 minutes of question.
Thank you so much, and thank you for being here and your patience. As chair of the Congressional Black Caucus Health Brain Trust, I'm deeply concerned by the disparities that this pandemic has brought to light due to our nation's history of discriminatory policy leading to differences in health outcomes for people of color. Time and time again, when resources are scarce, some communities are forced to do without the goods and services they need. You identify multiple situations in which the United States would face a shortage of supplies needed to respond to COVID-19, from masks to swabs and other testing materials, and potentially the supplies that deliver a vaccine when one is ready. During COVID-19, we've seen some states forced to pay significantly more because they're on their own to procure those medical supplies. Not every state or locality can afford to do this. Knowing what we do know about how scarce resources are procured and distributed, what impact will shortages have on lower income communities?
The shortages will impact across all of America, and unfortunately, it actually increases the concern in communities that aren't part of the mainstream or might have lower socioeconomic status. So I think it has a significant chance of increasing the risk in those communities.
How have you seen this impact the devastation of the disease in these communities?
These communities have, the data are showing that they're hit very hard, and we don't actually have the information yet to understand fully what's behind that or why. And it has health status or access to health care or other immunization status or health care status. So we're still learning a lot about that. However, it's really important to think about when we have diagnostic tests and other things available, that they are available to everyone. And many of these tests that we're developing today are very expensive or in very rare supplies. So we need to make sure that we're developing and making available tests that are not just rapid and accurate, but low cost, and so everyone who needs a test can access those tests.
Did you attempt to urge HHS leadership or the administration to consider preparedness, outreach, or targeted resources for these populations? Or are you aware of any HHS administration actions to target resources outreach to these vulnerable groups?
I've had some conversation. There have been some conversations, I should say, focusing on groups that are harder to reach in a different socioeconomic status. I'm not sure that there is a solidified plan in place just yet to make sure that it's more than a conversation.
Doesn't sound like there is. In your testimony, you recommend establishing a national standard and coordinate equitable distribution of equipment and supplies. Will this help to ensure that every community can access the equipment and supplies they need?
That is what's needed.
Will more equitable distribution of equipment and supplies help to address the inequities we're seeing in the impact of COVID-19 on communities of color?
Yeah, absolutely.
And do you feel in the last bill that we passed, we made sure that there was passed in the bill better data as far as race, and not just who died, but who was hospitalized and so on and so forth, because we're hoping that better data will inform policy. How do you feel like that'll help?
I think that's very important. I think it's a wise move.
Okay, good. And we're supposed to get a report 21 days from when the president signed the bill, then 30 days, and then 180 days.
I'm not aware of those guidelines. It comes in a different area, but I think reporting and oversight of that is important.
And then lastly, you've been sitting in that seat for a while, but is there anything that we haven't asked you that you want to say?
It's a really important question, and I've thought a lot about that. I think to highlight the things I talked about in my opening statement is we need transparency in the science, and America needs to know the truth. This is a devastating pandemic, and not just for health, but also society, our economy, our jobs, our livelihood. And if we do not take seriously the call for action to put specific things in place, a coordinated national plan for testing and response, an equitable distribution of these limited supplies, and ramp up and prepare for what will be a very devastating fall if we don't have the right supplies in place and raw materials, then this virus will overcome us in significant ways still. So we have limited time. My message is we have limited time. We have the ability to do it. We have the greatest scientific minds in our country to do it. We need to listen to them, put the plan in place, and everyone get busy stopping this virus.
Right. I know it's very, I had 3 people in my family with it, and I lost my uncle maybe like 10 days ago now from the virus. So it does definitely touch everybody. Thank you, and thank you for your patience.
Thank you.
The gentlewoman yields back. Minority Reserve. All right, then we'll go to the gentlewoman from California, Ms. Barragan, for her 5 minutes of questions.
Thank you, Madam Chairwoman. Dr. Bright, one striking aspect of your account in your complaint to the Office of Special Counsel is the contrast between the public updates by the President and Secretary Azar on COVID-19 versus the analysis you and other experts were providing behind the scenes. I'd like to explore this disconnect and ultimately that the administration shared information that I believe was misleading. We need to do this to better understand what happened and how we can ensure that the administration provides the public accurate and constructive information going forward. Dr. Bright, you had learned of the COVID-19 threat by early January, is that correct?
Yes.
And according to your complaint, it was clear to you almost immediately that the, quote, virus was highly contagious, spreading rapidly, and could have a high mortality rate, end quote. Is that correct?
We were learning that from the outbreak in China at the time, yes. And each day we learned more information. It was actually more concerning.
And the World Health Organization confirmed your view that the virus was a big problem in a January 20 call to agencies, including HHS.
Okay, so the minority is now ceding their time, or reserving their time anyway, so they're done talking. So we're just going to hear several Democrats, and the information is going to get repeated. The bottom line is the virus was known to be an issue coming in early January. Warnings were given that we needed more PPE, we needed more supplies. At one point, priority was given to rushing out hydroxychloroquine to the general market without a doctor's prescription, to the general public, beyond clinical trials, just here, go ahead and take it, what have you got to lose? And that, unfortunately, delayed all the other things going on for those people who had to devote their time to getting that out there within 48 hours, to which Dr. Bright objected. He was eventually removed from his position. And more importantly, right now, he's gone on to say that, especially with the flu vaccine being needed in the fall, our lack of preparation in terms of getting the supplies that we need in order to produce a vaccine for all Americans, even if we can get a vaccine, which has never happened before in that short amount of time. It took 5 years to develop a vaccine for Ebola. That we're not doing the work that we need to be doing yesterday in order to get all the supplies, especially considering that a lot of those supplies, reagents, etc., needed for the vaccine are being produced in other countries. And so we can't just magically make them appear. Hopefully someone in charge is listening, and hopefully they're not, okay, Trump's going to take this all personally, and this will unfortunately just result in an attack on Dr. Bright because he's receiving vacation pay right now after being, why isn't he doing his job he was fired from? So I'm going to let you guys go. Trump's going to be speaking in Allentown at some point. It looks like right now they're just waiting for his arrival. So he'll land on Air Force One or helicopter, however he lands at the field. I'll show you the field here. Let me bring it over. That's not it, but that's us. So there we are. Let me bring that back. Let me grab the right tab. There it is. So here's what's going on the other stations. Oh, here's Mornings with Marks on. Okay, so we do have some Trump to cover. Hold on.
Joining me now
go back
is White
on
House
that.
Trade.
Oh, that's Navarro.
Safe on the job. The president says we rely too much on other countries for these critical supplies. Watch the president.
These stupid supply chains that are all over the world, we have a supply chain where they're made in all different parts of the world, and one little piece of the world goes bad and the whole thing is messed up. I said, we shouldn't have supply chains. We should have them all in the United States. We have the companies to do it, and if we don't, we can do that.
Joining me now is...
Okay, so apparently he was on Mornings with Maria this morning, so I should have that. In fact, we can check right now and see if I have that, and then I'll let you guys know if I will be covering that, because I can take a quick break and then come right back with that. Let's see if we have... This is YouTube TV, by the way, which I do recommend Mornings with Maria. Let's see if I have that recorded. Upcoming. I do not record that. Dag nabbit. So I don't have that, but there might be a way for me to get that. So I'll look into it. I'm going to take a break, guys, and I'll look into that. And if I can find that interview, I'll bring that up. We also have Trump from yesterday, which I was busy. So we have Trump from yesterday meeting with Colorado and North Dakota governors. So we've got that to cover as well, if you guys are interested in that. So I'll start a live stream in a few minutes after I kind of get my bearings as to what's going on and what we have to cover. So we definitely have the one situation with Trump and the governors, and we'll cover that, and then I'll see if I can find that interview with Bartoloma. If you guys have access to that, let me know. Shoot me a DM or tweet or something, and I'll cover that as well, because this is the first I've heard about that so far today. I woke up and immediately started covering the congressional hearing. Let's check back in with that, see if there's anything going on.
To do now. And number 3, what can we do to prevent?
Okay, so we've moved to just one Democrat after the other saying this was really bad, and we've sort of already learned that. If there's any revelations from that and somebody's watching, let me know. Okay, I will see you guys later as soon as I figure out what we're covering next. Bye.